Yeah. And what I'll do at the end, I'll send you guys and ladies information for your state written. I'll send you other stuff soon on the WhatsApp. So you definitely want to look at that because that's going to help you a lot. What I do at the end, I'll send you handouts to study. It's like your whole book condensed, exactly what you need to know. And it prepares you for the state written exam. And what I try to do, I send you videos to do with the state skills. Those will only be a guide and they state skill sheets and so forth that you could look at. And then I send you another one for another company I work for that how they do their so-called skill sheets. Okay, and you could just look at it, but you must follow your instructors. That's what it comes down to. Okay, 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8. Jason. Jason, can you spell your last name, please?
Pollack.
Thank you.
No problem.
Okay, I am going to send it out now for you, the attendance. Make sure you sign in. Okay. Attendance sign in, present. I just sent it to you all.
So we're all selecting option 2, right?
Funny, yes, but you know how it goes. I'll leave it up for a few in case anyone signs in a little later. You know, remember this documents everything, you know, your attendance, how long you stood on here with me and so forth. For some reason, you need to step away from the computer, step away, do what you have to do. Just come back, you know, leave it signed in because it's going to record everything in a sense of time. And if Christine or Irene or your dear ask, you know, whoever is your senior instructor saying, you know, were they there? Did they sign in? How long they stood with you? They can see it directly on the Zoom. Okay, so that's important. Okay, so give me 1 minute. I got 2 more. And then I'll start recording this. The 2 who just logged on, make sure you sign in. It should be the poll to sign in should be there. If not, sign out and sign back in or log in and log back out to Zoom. You should see it. Kelly, I got Kenneth, Alejandra. And Jason, Jonathan. Oh, there it goes. All right. Any questions for me from before that you did? Anything that you did on your exam that you was not sure with, or if I need to clarify it for you or anything like that? One of you did not sign in yet because I have a bunch of participants and one of you forgot to sign in. Make sure, double check. I'm missing one of you. I don't know which one it is unless I go back to the Zoom, and that takes a while. So there's a pain in the butt. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Please make sure.
Quick question. Is the sign in the attendance button?
The sign in here, the poll that I sent out is the sign in.
Okay, gotcha.
It tells me exactly who signed in. They're going to ask, you know, Christine. Okay. Definitely going to ask, you know, your senior instructor who went to Nuki's Zoom review and so forth. And then I have to send that email with your names to the senior instructor. And then from there, they take it from there, you know. They want to make sure if you need any type of help or if you fail the exam, they can focus on you or the others and see what they need to do differently. That's what this is all about. All I try to do is help all of you, you know. As close as I want to get you to exam is things we review. You know, that's what I try to do to make sure you understand the material. Okay, I'm going to start recording. Record to cloud.
Recording in progress.
Beautiful. Okay, good evening, everyone. Frank Nuki here, one of the senior instructors, CICs from LaGuardia Community College. We will be going over a review of Chapter 7, and I think is also Chapter, I think it's 11, which is the airway, and then also part of the human body, okay? Part 2, supposedly. So we'll go over that, make sure you understand everything there, okay? So you should see it on this side here, it's talking about lifespan development, okay? How it always starts and begins with, it starts with the National EMS Educational Standards Competencies. It's going to talk about the EMS system, the well-being of emergency medical technicians, you know, medical, legal, and so forth, ethical issues. Okay? You're going to see we're going to get into lifespan development of different ages. Okay? That lifespan development, I'm going to definitely talk about the infant, the child a little bit, the adolescent, and then it continues up to like your adults and so forth at a certain age, and then middle age, and then it goes to elderly. I'm going to tell you what to expect with them and what they like to ask you, especially when it comes to test questions. You have to go back and read that again if you're not sure. Highlight that. If you have your textbook, I recommend highly that in your textbook you go over certain things there and make sure you understand it. Remember, read to understand, not to memorize, okay? Make your flashcards, whatever you have to do. Okay? It comes with the introduction, okay? Patient assessment, how you approach your patient, from the infant all the way down into the elderly. You're going to notice when you get to pediatric lectures and pediatric chapters, it's going to be like a toe to head assessment, and they utilize what we call the PAT, Pediatric Assessment Triangle. For the adults and so forth, a certain age, we go from head to toe when we evaluate them, when we do a patient assessment on them. So you're going to see it's going to be different. What I definitely need you to concentrate on is right here. That one right there on your book and page for that for you would be on page 254 and 255 in your textbook. We definitely need to talk about this because they'll give you a question and ask you about the neonate. Neonate, once the baby's born, okay? Hold on, something else is popping up. Once that baby's born, okay, into 30 days. Know that. Born to 30 days, neonate, or they call it the newborn. Okay, make sure you know it both ways, okay? Now, that neonate still falls under what we say infancy or the infant, okay? So when they're born into age 1, infancy, you're going to see things are going to be different than what we want you to know there, because when you check pulses, for instance, let's say you're going to check the pulse of this infant or neonate who's in cardiac arrest, you check the brachial artery and you check for not breathing. Their pulse for that infant is definitely the brachial artery in the arm between the bicep and the tricep of theirs, okay? Are you talking about the pulse here? Yes, Kenneth. What I'm talking about, pulse that you need to check for that. The number is good, and you're going to need to know that later on, okay? And you'll see numbers here. But I'm talking like if an infant was in cardiac arrest. They always mention for that one. And then you need to know this about infants. They're called central pulses. If they ever ask you in a state or class, what is the central pulses of that infant? It's the brachial artery and the femoral. Brachial artery and femoral. Okay? Friend, above that age 1, technically on that pediatric and the adult, you're going back to central pulses to do with the carotid artery and the femoral. You need to know that for the future. Okay? So you know the infant and you know the child with the adult. If you see a word called peripheral pulses or distal pulses, they're talking about the other pulses to do with your extremities. Okay? The one they always check, a lot of people, is the radial pulse right here, which is on the arm, where the thumb is, down where your carpal is, which is your wrist. Okay? They can't get in. Okay, let's see why they can't get in. Hold on. I hear them trying to. I hear it beating. Okay, let's see why. What's going on here? Why is it not showing? Give me 1 minute. Thank you for letting me know. They should be able to log on with no problem, especially if they have the, hold on. Computers drive me crazy sometimes. Okay, I got Lewis and I got Smith. Okay, got them both. I got Lewis and I got Smith. Thank you. Thank you for letting me know. Appreciate it. Let me write this. Lewis. Okay. Thank you. Sorry about that. And Smith. If you see that again, let me know because it should pop up for me to admit them in with no problem. Okay, let's go back to this. Thank you. Make sure you sign in also just in case, the ones who just got here, okay? Sorry.
Question.
Yes, talk to me.
All right. So with the radial pulse, do you also check that with infants? God forbid if they're in cardiac arrest. Would you check it through the radial pulse as well?
No.
No.
No. Our infants, I want you to go straight for the brachial. If they're in cardiac arrest and that newborn all the way up to 1 year old, you're going to check the brachial artery. And if that doesn't work, of course, then you're going to go to the next pulse would be with the femoral. But definitely, it's the brachial artery first.
Okay.
CPR questions, American Heart is going to talk about that. They're going to ask you a test question down the state. Good question, Kelly. Okay, so know this and up to 1 year old. Okay. The weight I hardly never see on test questions, so don't worry about too much of the head. The head, yes, very large. They call occipital region. That's always a test question. You're going to see in the book here, there's going to get a section called special populations, and you need to know the difference in the A&P, anatomy and physiology, of the infant and let's say the adult. So certain things you need to know for sure is that the infant's head, the occipital region, very large, their tongue, very large, okay? And especially here, their trachea, very narrow, okay? Like a funnel cup. You need to know that when you see test questions in the future on that. So we'll get to that in a little bit. Here, always a test question right here, pulmonary. We noticed that the infants, they breathe a certain way. We have a tendency of using that they're belly breathers, okay? But up to 6 months, their nasal congestion, they're mostly breathing through their nasal cavity, okay? So if that's congested, that's going to affect their breathing. So you need to know if you see test questions, anything up to 6 months, look for that their nasal needs to be clear, their nose, their nares, okay? Make sure you know that. So they'll ask you a question on that. Make sure you prepare. Then you know they go back and tap that belly breathing. But this always, before those 6 months, make sure you know that just in case, because it gets congested a lot, and then you have to take care of them. Remember what we said about them too. Large tongues, head very large, narrow airways, easy for them, airway to be obstructed. Their rib cage is less rigid, in case they ask you that. Okay, make sure you know that. And when you BVM them, bag valve mask them, squeeze that little bag, you don't do this. Watch my hands here. You don't do this. No. In neonates or infants, like this. Watch my hands. You notice it's like little puffs, enough for the chest to rise. That's what you want to do. If not, they get into a point that if you do it too forcefully, it results in a trauma and pressure there called barotrauma. You can damage those lungs. They say you could pop a lung, okay? Especially if they were intubated, say, by medics or in the hospital, and the ventilator was going too powerful, pop that lung. So just know that, all right? Know that their respiratory muscles are not developed like they should, and they have fewer alveoli in the lungs, in case they ask you that. Make sure you know that just in case. That's all to do with the pulmonary system. So when you get back to this video, you take that information out there. It's good for you to know for the future. Now, these coming up here, always test questions. You have to know each one of these. Okay, they have the moral reflex, also known as the startle reflex. That's when the neonate is caught off guard and it opens its arms wide and spreads its fingers and seems to grab at things. Make sure you know that. That's the moral reflex or startle reflex. That palmar grabs, that's when you put like an object in the neonate's palm and they grab it. Okay? That ruling reflex is when something touches like their cheek and they turn to that direction when they touch. Okay? So know all these. And then, of course, you got the last one, which is a sucking reflex, occurs when a neonate's lips are stroked. Okay? It's amazing that how we know that the infants, the neonates, are able just to do things with certain reflexes. You know, when the mother's breastfeeding the baby and they know how to suck on the nipples in order to get the breast milk, which is very healthy for them. Okay, so know these things just in case they ask you all these things in your book. If you're following your textbook and you have it in front of you, you should be looking at neonate page 254, 255, highlighting those things I said before, our pulmonary system, the neonates, and then 256, where it says the nervous system, highlight that section. And on 256 to your left side, the second paragraph and the bottom, where it says, when providing the bag valve ventilations and infant, be aware that the infant's lungs are fragile. Forceful ventilations and overinflation increases pressure in the lungs and can result in pressure-induced trauma referred to as barotrauma. Make sure you highlight that in case they ask you that. Now, go to the bottom of the nervous system, the fontanelles, aka soft spots. I'll say it again. Fontanelles, aka soft spots. In this state, you will see it. What's another name for the fontanelles, which is this one coming up? These fontanelles. These two numbers you need to know. Always test questions. Posterior fontanelles, that means towards the back, it's up to 3 months when it fuses or comes together. The anterior or fuses between 9 to 18 months. So it depends how I ask you the test question. If I say just the fontanelles fuse together between how many months, you have to know this, 9 to 18. If I say only the anterior, you still have to know this number. But if I use the number posterior and only ask you a question on posterior, you have to know that the posterior fuses within 3 months. And I'm going to show you the diagram, and the diagram for you is on the same page of 256 in the bottom. So make sure you understand fontanelles, aka soft spots, okay? That's important. Now, in that same section, and on the left side of 257, it continues talking about the fontanelles. You see Nuki's bald head. If you see my picture in, or my old picture in room 320, I forget what it is, 329 in the back wall, you see me when I had a little more hair. Now I just shave everything off. But imagine Nuki with the fontanelles, okay? If you saw this bulging out, make believe Nuki's an infant and you see this bulging out, intracranial pressure, ICP. There's swelling going on there. If you see it like it's sunken in or depressed, that's dehydration. Make sure you highlight that and know that in your book. Okay? Should be on the left side on 257. Okay? So it tells you a lot. In the future, you're going to see a word called turgor. 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 Okay? Look at Nuki's hand right here. If I pick up the skin and I squeeze it and it stays up like this, that's called tenting or a form of turgor. It's supposed to go down just like that. You just saw that? So that's good. That means I'm not dehydrated. If I was dehydrated, and let's say I was an older person or elderly or whatever, certain age, it would stay up like that. That's called tenting or turgor. In the infant, if you will grab the back of the occipital region, you are able to squeeze the back of their skin here and it stretches. That's severe dehydration. That's a major problem there for that infant. So know the words I just told you. Turgor, tenting, like a tent. Okay? This is how it looks. That's what you need to know, just in case they ask you. Concentrate on the anterior and posterior. That's it. Don't go too crazy. Don't read into these questions. Stop second guessing yourself. A lot of you do that. I guarantee it. You read something, you know it's the answer, and then you change it. And you change it from the correct answer. Go with your gut feeling, especially if you understand that material. It's very important you ask your instructors or myself when you see me, what you think the answer could be. I put this answer and it's wrong. Why? And I'll try my best to explain it to you. I really don't go over like the 2 months or 6 months or the 12 months. I just continue here and go and skip over certain things because I rarely see it on exams. I know it's in the textbook and you may have it on a future exam. Read that, make flashcards, whatever is easy for you to understand. Sometimes they have these major charts and 257 and it breaks down everything. Noticeable characteristic, it says of various ages. You could put that down, you could highlight them, make your little flashcards, whatever you want to do. This, you need to know that. Immune system to do with antibiotics via breastfeeding. Very important. Whatever that mother takes or took in the past, and then she gave birth already, whatever she's eating, that baby's going to get. Okay? Even things to do with, what you call it, the COVID, when mothers who couldn't have their infants or their children at a certain age that they were still breastfeeding, get the vaccines. If the mother was breastfeeding that infant and feeding that baby that way, and she took the vaccine, they say through the breast milk also, that baby is getting that vaccine. Okay? This is all to do with probably CDC and things like that. I don't know, nothing really to do with that, but this is what I know of research and what I read. That's that chart I told you about. You could read that, look over it. This always exams right here. This you must know. Psychosocial changes. Continue, read that. They're going to give you words like that bonding based on secure attachment. They'll give you the word anxious avoidance attachment. That's when the infants are found in infants who are repeatedly rejected. Make sure you know that just in case. Highlight that. It's in your book. Children show little emotion response to their parents or caregivers and treat them as they were strangers. Then they have the other one called separation anxiety. It's common in older infants. Highlight that. And then trust and mistrust refer to the stage of development from birth to about 18 months, which involves infants, and needs being met by this or parents or caregivers. Okay. That's directly from your book. Make sure you highlight that and know that, please. Okay. That should be in the bottom of page 257. Highlight that in orange or whatever color highlighter you have, yellow. And I'm 258. And then they got another one to do with trust versus mistrust. You can highlight that also, the one I just said before. Now, we rarely take blood pressures on age 3 and up. excuse me, 3 and down. We rarely take a blood pressure down. Mostly we would take blood pressures for like a 4-year-old, 5-year-old, 6-year-old, and so forth. But 3 and down, no. We look at that PAT, pediatric assessment triangle. We evaluate that patient that way. It's rarely that we would do that. But if we were to do certain things, depending on the age and take a blood pressure, there's a formula I want you to know for the future. It's 70 plus 2 times their age, okay? 70 plus 2 times their age.
And what's that calculating again? Sorry.
70 plus,
No, what is that doing? What is that math doing?
oh, I'm sorry. I am so sorry, Kenneth. Nuki just brain farted. He was reading something. Okay, had cerebral flatulence for a minute. Okay, what happens there, when you were to take a blood pressure, for let's say the age of a child, 2 times the age from 1 to 10, 1 years old to 10 years old, we take 2 times that, and that 70 represents the systolic. So we're saying to you, if they were 6 years old and you took 2 times 6, that's 12. 12 plus 70 is 82 systolic. So we're telling you that child of that age should be 82 systolic or greater. You following me now? So that's going to be used later on in the future. I always see that formula, 70 plus 2 times the age. Of course, 2 times the age is in parentheses, and you know you always do that before you add that number. Okay? So remember, 70 plus 2 times the age to do with systolic blood pressure. $259, they have trying to find where I wanted you to highlight it. No, I don't see it. Never mind. It's on the next page. 260, bottom right-hand corner. Okay, you're going to see physiological changes or psychosocial changes, prevention reasoning, okay, conventional reasoning and post-convention reasoning, and part to do with self-esteem. That's on page 261. I need you to highlight that because if they give you any test questions, it's going to be on that. Trying to find out where did I have it that I saw it for you. Could have sworn it was here before, but highlight that just in case. Here it goes. I knew it was here. Right here. 1, 2, 3, 4. Make sure you highlight that, okay? That pre-conventional reason, children act almost purely to avoid punishment and get what they want. You know, you've probably seen that a lot. Conventional reason, children look for approval from their peers and society. Post-conventional reasoning, children make decisions guided by their conscience, and then children begin to develop their self-concept and self-esteem. Highlight that in case they ask you a test question on these 4. Now, you know here, this is always a test question. I think one of you put, I think it was Kenneth, he put that the normal heart rate, he thinks for infants was 100 to 160. On infants, it's always faster. We got a couple of people who can't again. Oh my goodness, what's going on here? I'll do it again. Sorry about that. Where did I see it? Go to the chat. Oh, I remember that. Yes, Devin, that's right. I remember that. That was the one they always did. What you do first, what's in parentheses, exponents, multiplication, division, addition, subtraction, in that order. And then you did that, my dear Aunt Sally equals PMDS.
Yeah, it's just like a way to just a way to remember order of operations for math.
Yes, that's right. It's been a while, but yes, you're exactly correct. Now, let me try to get those students in. Where are they here? Kenneth, do you know where exactly? Because I don't see them popping up on my side.
I don't know. That was from way before. That private message was from a while
Okay,
ago.
so they did come in. You're not
Yeah,
talking
it was
right now.
Lewis and I think Smith.
Okay, I thought I saw that again. Thank you so much. Sorry about that. Thank you. And I think I got them also. Make sure that you guys who came in a few minutes ago, make sure you sign in. The poll was sent out already, okay? Okay, let's continue here. My apologies. Now, getting back to this, 60 to 100, you need to know these numbers. Average post rate for your child and adult, they always go by this number, 6,100, okay? Mostly you're going to see this in adults. Anything less than 60, bradycardia. Anything more than 100 or 100 or more, tachycardia. You need to know those names and those numbers when you see test questions to do with that, okay? That number over here, always need to know this too, 12 to 20 is the norm. Other numbers you need to know is if it's less than 12. So let's say they give you a test question 8 or less or 28 or more. And this is on respirations, especially for the adult. EMTs ventilate, medics intubate. Okay, so know those numbers because you will see it again. 8 or less or 28 or more. That's the rate. EMTs ventilate these patients, medics intubate them. Now you have to be careful with that because sometimes a number like 24, which falls in between that, above the 12 to 20, could be their norm. They could have a history of COPD or asthma or something like that, chronic obstructive pulmonary disease. And when you see that, you're thinking, are they pale, cool, diaphoretic? Or are they pink, warm, and dry? If I'm breathing 22, 23, 24 times a minute, but I'm pink, warm, and dry, that's my norm. So be careful how you read that question. Look for things with inadequate breathing. You remember that probably in airway and normal breathing. We're going to go over that later, okay? But make sure you know that because that's how they'll ask you test questions. At the adolescence, you have here with the girls developing their periods, okay, or the menstrual cycle. Make sure you know that it's on the average of this age, okay, probably younger than this age also. I remember my daughter, I think she was age 9 or 10 when she started developing her menstrual cycle, okay? So just in case they ask you that, just know that.
But the normal age is supposed to be 16, right?
They say girls finish by 16, okay?
Oh,
This is to do with everything to do with your reproductive system and so forth. But the average could be once you see like hairs underneath the underarm for the males and things like that. That's according to American Heart. And you see slight breasts on the female. They're saying, okay, they're going through a form of puberty. Okay, but be careful with the menstrual cycle because I've seen it at younger age. Okay.
Mhm.
Okay, I have this to do with the blood pressures, pulse rates, and systolic. Okay, they're going to tell you that this number here, 90 to 120, is the average systolic that patient or person or this age, young adults from 19 to 40 should be. So a lot of you will fall in between these numbers. These are the good numbers to know, systolic. Okay, make sure you understand that because if you're like 140 over 90, so this systolic number here is not 120. Let's say it's 140, the top number, and you have a 90 diastolic, according to American Heart Association, you have the beginnings of hypertension, high blood pressure. Okay, so the average here should be between those numbers. Some of you young ladies or young men could be 110 over 70, 100 over 60. You notice that it always looks like it's a 40 to 50 separation in systolic and diastolic. 120 over 80. That's 40 millimeters of mercury difference, if you notice. A person's 140 over 90. That's high blood pressure, but you notice it's like 40 to 50 millimeters of separation there. Okay, so just know it cannot be coming together like this. If you ever see something like that in an adult, the blood pressure, systolic and diastolic coming together this close, they have a form of what we call cardiac tamponade. That heart is being squeezed somehow because of trauma, okay? And there's blood where it's not supposed to be in what we call the pericardial sac. You're going to see that in the future, okay? And we'll talk about that in the future. This you definitely need to know, okay? 41 to 60. They go through a lot of problems on page 263. Okay, and 264, bottom of 264 to the left of that first paragraph that's on top, you're going to see them talking about them having different problems from diabetes to cancers and so forth. Need you to highlight that in case. 264, left-hand corner. Here it goes. Cancer, vision problem, hearing loss, diabetes, hypertension, weight problems, and things like that. Exercise, health, everything. This is the age. Now, past that age is when you get to the older adults, 61 years old and older. And you'll see it talks about the word arteriosclerosis. In your book, if you have a little pen or pencils preferred, put an F in front of that word. And if you put an F in front of that word on 264, bottom right-hand corner, where it says the cardiovascular system, okay? And it's going to bring it up in a minute. Let me bring it up for you. See if it has it here. No, I do not see it. I thought it was going to, oh, here it goes. See this word right here? There's two words that are going to give you this on your exam. You need to know these words. Atherosclerosis and arteriosclerosis. If you put an F right here, okay, the first three letters spell fat. Okay, you need to know that this word is to do with fat, lipids, cholesterol, calcium deposits, plaque. Think of everything I just said. Okay, so you're going to say, what does Nuki mean by that? When and as you get in that age or older, you could develop this ahead of time, okay? You could have this ahead of time because that's where your gene pool is and so forth, okay? But this one, F is fat, atherosclerosis, okay? These three letters now, because I put an F here, it means fat, lipids, which is the medical term for fat, okay? Cholesterol, calcium deposits, plaque. You'll see another word spelled almost similar to this called arteriosclerosis, and it's A-R-T. A-R-T. When you put the F in front of it, it spells the words fart. Now, the reason why I bring that up to you is because a lot of students, when they see those words together, they forget which one's which and what's the meaning for each one. Okay? So you know the meaning for this one. Well, let's say they A-R-T, and you was to put that F in front of it and it spells farts. I want you to know that meaning for that is the thickening and hardening. The thickening and hardening. Okay? You need to separate those two words. You're going to see that further when you do exams and you get into cardiovascular emergencies and the elderly, those words are going to come back also, especially this one. Okay? So please make sure you know that. Did I lose anybody so far?
No.
Good. Excellent. Just want to make sure. Respiratory, highlight that in your book on page 265. I want you to know that respiratory, everything is decreasing. If you notice here, the size of the airways increase and the surface of the alveoli decrease. Okay? The elasticity, when the contraction of the areoli is supposed to exchange the gases, it's very difficult. Okay, there's a reduction, a decrease on it. Okay, the strength of your intercostal muscles and your diaphragm also decrease. It's not like the age you are now. When you get past that age and you're in the 60s or higher, it decreases. Everything starts going down. The average, this is according to this textbook and prior, the way they used to word it. If you're age 30 and you're past that age, 31, 35, 40, they say that you lose 1% of your body functions depending on your health each year that goes by. So if you're 35, technically, depending on your health, you lost 5% of your body functions. So imagine a 65-year-old. After age 30, technically, they lost 35% of their body functions. Kenneth, you're too funny. That's a good one. So Kenneth, if you're saying that maybe if it starts next year, so you may be 30 if that's the case. Listen, you are all young. Stay young. Don't rush yourself. Trust me. You get to a point in your life when you were younger, you couldn't wait till you were 18, and 18, you couldn't wait till you were 21, and 21, 25, and 30, and now you're saying, oh, crap, Nuki's right. Oh, my parents are right. You don't need that headache. Live, enjoy life, all of you. Okay, so remember here about respiratory, highlight that in your book. And it continues. Look over here, coughing and gag reflex diminished. That's the back of your throat when you have that gag reflex. You learned in the airway that they insert an OPA, right? That oropharyngeal airway, 2 ways of turning it. And if they accept it, they have no gag reflex. That's a bad thing for the patient. But if they were to gag because of that gag reflex, that's a good thing because you know that body's still responding. So know that all this decreases. You're more susceptible to lung infections, upper respiratory infections, and everything else, chronic bronchitis, emphysema, cancers possibly, and so forth. Okay, so pneumonia. Okay, so just know that under respiratory. You heard probably words like wheezing, wails, crackles. Okay, we'll talk about that too. You're going to learn that more in airway. You need to know all those words. Here you need to know to do with this word right here, insulin. They're going to ask you in the future, insulin, what does it do? It's like the lock and key. That insulin, okay, allows the glucose, which is the sugar, to go into the cells, okay? You need to know that. Insulin is a hormone, okay, that is produced at the pancreas. And if you need to know the exact location, it's called the islets of Langerhans. Islets of Langerhans. Okay, that's an area where that insulin is being produced. Insulin is required. It's a hormone that develops at the pancreas. They ask you a test question, you know that. Make sure you understand that. Are there many different other hormones? Yes. Okay. Hold on. Got something else. Okay, got it. Okay, thank you. Sorry about that. Okay, digestive system. You're going to learn things and go through the digestive system. You learn part of this in your human body. Okay, know that you're going to have problems and changes in your digestive system also. Okay, from tooth loss. I know it's kind of funny, you know, chewing and so saliva secretion decreases also. Okay, the ability for your intestines to do what we use the word peristalsis, contract. Okay, that's how it brings all your food down. You could stand on your hands or your head upside down, eat something, and it's still going to go to your stomach right now. But as you get older, someone going down. That word peristalsis is the contractions of the intestines, the esophagus, moving everything. That's how everything is moved. The word they use is peristalsis. Let me see if they have it here for you so I could tell you to highlight that if it's here. Yep. Bottom 266, left-hand corner. Okay, make sure you highlight that. It's about the second or third sentence, and you see the word peristalsis, the process by which intestinal contractions move food along the digestive tract. Slows with age. Highlight that. So if you see that word in the future, you know what it means, what they're trying to ask you when it comes to test questions. Okay. Can you wind up with your gastric acid decreasing and diminishes? The answer is yes. Can you have decrease in other parts to do with the lacticity of your anal sphincter to cause the fecal incontinence and so forth, and urine also? Yes. Things are not like it used to be. Okay, at that age. So if they ask you anything for the elderly at that age, you know. Renal system to do with your kidneys. Okay, you need to know that. That also decreases just in case they ask you. They ask you how it flows. Kidneys down the ureter to the urinary bladder to the urethra and out it comes. That's the order you should know. That's what they may ask you, if anything. Here, nervous system, do you believe after that certain age, the brain shrinks? The brain actually shrinks. In your book, they even show a picture of how that brain shrinks. And you look at it and you say, wow, is that serious? Yes. So in the future, Nuki has to expect, depending on what I may wind up with, and I hope I don't, that I wind up with maybe some form of dementia or something like that, you know, or I just forgetting things. It depends on what part of the brain is shrinking. Okay, so they talk about the nervous system, your touch and feel, your peripheral nervous system, okay, to do with your sensory and motor decreases also. So everything's not like it used to be. Your meningenes, you need to know that word, meningenes. This is what word I'm talking about right here. This right here. Your cerebral spinal fluid and the meningenes, especially the cerebral spinal fluid, works as a shock absorber to protect the brain and your spinal cord. Okay? So when you think of your CNS, central nervous system, you think of the brain and the spinal cord. But then when you think of the fluid, cerebral spinal fluid, that helps protect your brain and your spinal cord. And also these meningenes. This is the letters I want you to know, DAP. If they ask you, what are the three meningenes, DAP, DAP, write this down. The first one is called dura mater, Duramater, dura mater. Okay? Need to know that word for the future right here. See that dura mater right here? Meningenes, that's what you need to know. And then the A is called arachnoid. Okay? And then the P is called pia matter, PIA matter. So if they ask you about the meningenes, you know it. If something was affected and you had some kind of problem, and they give you this as a test question to do with the meningenes, think of the word meningitis. Okay? Meningitis, inflammation. It could be bacterial or viral meningitis. Think of these signs and symptoms. Fever, probably slight fever, headache, stiff neck, possible rash, meningitis. You got that? So if you see a test question like that, you know how to answer it. That's what you would probably see in the future. There goes your peripheral nervous system that I said before. Also diminishes. That's with the touch and the feel and so forth that your body's used to. Your reflex slows down too, just in case they ask you. Sensory, definitely going to decrease. Know that. You are prone to that problem also, okay? So make sure you know that. You wind up maybe needing hearing aids, okay? Your vision, you may wind up with cataracts, cloudiness of the eyes, future test questions. Make sure you know that, okay? Just in case. And all that is on page 267. 266 that we just went over. I told you what to look at and highlight. More of the nervous system is in that paragraph. And on the right side, the first and second and third paragraph, the third paragraph of 266 to do with the nervous system, make sure you highlight those things there to do with the meningenes and so forth. Trying to see if there's anything else I want you to know. Otherwise than that, we're good here on this chapter. So we will go over the notes at the end and we will see more or less if I touch base on everything I was supposed to do with that. But so far, so good. Question time. Give me the answer. Put it in the chat, please. Even if you're wrong, just participate. If you're wrong, you're wrong. If you're good, you're good. If you're not, it is what it is. Okay? He's not here to criticize you. Here to help you. Okay, and getting a few B's. I like to go 3 people or more. When providing the back valve ventilation to an infant, what is the most important to remember? And the answer is B. And infant lungs are fragile. What I love about this is always it gives you the rationale, right? It is important to remember that an infant lungs are fragile. Ventilations that are too forceful can result in trauma from pressure or barotrauma. Due to the large size of the infant's occipital, remember that part of their head, and the increased flexibility of the trachea, the airway can easily be inadvertently occluded by incorrect positioning, either overextension or overflexing. In other words, I want you to remember this. In infants, the neonates and infants especially, the head position is not the complete head-toe chin lift. Don't do that. Okay? And don't do, this is extension, this is flexing. Don't do that. You overdo that, you kink the airway. In other words, if this napkin here, or tissue I have, was their airway, trachea, okay? It's supposed to be straight, okay? You may have to put underneath their scapular airway, maybe a sheet, maybe a blanket or something to get the whole airway nice and straight. But if you were to do the head-toe chin lift on that, you do this to them. You kink that airway. So you overextended it. You hyperextended it. If you do it this way, the head up, you kinks it again. So that's where you get that overextension and that overflexing. Make sure the words they always look for in test questions for that, sniffing or neutral position. Sniffing or neutral position. Make sure you know that and understand that.
Meaning like when they're just laying down flat completely?
Yes, that's
Okay.
right. So when they're laying down flat, you want to make sure, because they got that big head, right? You want to make sure that if you have to put air in their mouth to go down the trachea, remember you're going to squeeze the bag very gently enough for the chest rise.
Right.
You have to have the airway and the trachea all straight. So they can't be this way and they can't be totally back. It has to be in a neutral sniffing position. So that's when you put the sheet or blanket underneath their scapula and it goes like this to them. It picks it up slightly because you put it behind them because the head is so huge.
Okay.
Or the sniffing or neutral position. Okay? Okay, next question. Even if you're wrong, just pick it, you know? Okay, getting a bunch of C's so far. You see an infant capable of reaching out to people in June, and she is most likely, and the answer is C, 4 months of age. And infants' psychosocial development begins at birth and continues to evolve as the infant interacts with the reaction to the environment at 4 months of age. An infant is likely to start reaching out to people and drooling. And then the reasons, the other ones for why it's not the answer. Number 3. These are the ones I tell you that you should have highlighted before because you never know. Remember that? I say, hey, make sure you know this. You never know if you're going to see it on future exams. Maybe exams to do with the class or the state. Okay, I got a few B's. Say that again, Kelly?
Tricky.
Well, go with your first go. What you just said, B?
I put D.
You put D, and it actually is B.
Oh, okay.
Infant who is okay. An infant who's repeatedly rejected experience what type of attachment, and that's B. Anxious, avoidant attachment. Anxious to avoid attachment observed in infants who are repeatedly rejected. If this attachment style, children show little emotional response to their parents or caregivers and treat them as they would strangers. These children develop an isolated lifestyle where they do not have to depend on the support and care of others. Okay, let's try the next one. Number 4. Oh, we know this one. Why do codes develop so easily in toddlers and preschoolers? Right? It's all of these, right? Delta, right? D. Everything. But you see, they experience loss of passive immunity. They do not have well-developed lung musculature. They are spending a lot of time around playmates and classmates. Oh, yeah, that's for sure. D is the answer. All these choices contribute to toddler and preschooler increased likelihood of contracting a cold. Number 5. What if I tell you D is not the answer? What if I tell you A is not the answer?
Is it C?
Nope, it's B.
Oh God.
Yeah, it's okay. Don't go crazy, okay? I rarely see test questions like this on exams, okay? If they're going to give you something, it's definitely going to be what we went over before. 60 to 100, the adult, bradycardia, tachycardia, things like that. If they give you something like a CPR question, it's probably going to be to do with the infant, okay? So don't go crazy if you got this wrong, okay? B's the thing. What I used to do when I was not sure, I always carried on with me this little field guide to do with BLS when I was EMT. And when I became a medic, something for ALS. It would give me numbers and things of what is supposed to be the range and the medication and what tube I'm supposed to use in my shirt pocket or in my back pants pocket. Okay, so are you going to remember everything? Let me tell you something. Doctors to this day go back to their PDR that's on top of their emergency room desk or behind, and it's that big book that's okay? And it has thousands and thousands of pages with everything to do with medical. So what they think it is to do with signs and symptoms and everything. You think the doctor's going to remember every little thing? No. He or she also goes back to and get reference, if not from the book, from the computer, or their fellow doctors. Okay, there goes the rates from before. Okay, number 6. Getting a bunch of B's. I got 1 C, bunch of B's. And the correct answer, a school-age child looking for approval from his peers and society is demonstrating what kind of reasoning? And it's B, conventional reasoning. During school-age development, children begin to develop their self-concept and self-esteem. It is critical time in human development. Children who look for approval from their peers and society are demonstrating conventional reasoning. That's B. Self-concept. Self-concept. That should have gave it away to you. Self. The answer is A. Our perception of ourselves. Self-concept is not how we perceive ourselves. A lot of us would put how we feel about ourselves, okay? But it's how we perceive ourselves. It's all wording. And if you look at over here, how we feel about ourselves, that's an example of self-esteem. Self-esteem, okay? This example, we perceive others. That would have been D. So the correct answer was A. So when you go back to all this, that's why it's A. Number 8. A lot of you put in C. Why should you be concerned about a 16-year-old patient who seems depressed? And C, adolescents are higher risk for suicide. It is so sad. So sad. Adolescents are struggling to create their own identity, but are caught between two worlds. They want to be treated like adults, yet want to be cared for like young children. Many adolescents are fixated on their public image and are terrified of being embarrassed. Because of all these factors, adolescents are at a higher risk for other population for suicide and depression. There was that young lady who got assaulted in school and then she wound up committing suicide, right? And now they're charging, I think, those girls who beat her up. Number 9. Yeah. Why do finances become an issue during middle adulthood? Middle adults are often supporting both their children and their parents. It's true. Times have changed. The parents of adults in this age group are getting older and now need care. Most of the elderly in the United States are cared for by a family member inside the home. Therefore, a person in middle adulthood may need to manage children who are leaving for college while at the same time caring for the parents who require greater assistance. Number 10. Yep. A lot of you put to do with the size of the airway increases and the surface area alveoli decrease, the natural elasticity of the lung decrease, the overall strength of the intercostal muscles and diaphragm decrease. All the above makes sense. Okay? Not bad. Now, you went over this lecture with your senior instructor. Okay, so we're not going to spend too much time on this, but we definitely go over certain things to make sure you understand this material. It's very important that I make sure that you know numbers and certain things that you may see on exams and what they always like to ask, state or class. So make sure we understand that when we go over it, that you're not lost. I want to make sure you understand that material. Let me just get to my section.
Look, you had one more question before you move on to the next chapter.
What's up?
So you said the brain shrinks after a certain age, correct?
Yes.
At what age does that usually happen, like an average, if it was a test question, if they were to ask us?
I don't think they would do that for you. They would just say the elderly past that 61 and older. It could be depending on the person's health and history. You know, I can't give you an exact number because I don't know it. Okay. But I've never seen that as a test question to do with age. I did see a test question to do with, does the brain shrink? And the answer was yes, true or false question, something like that. But not to do with exact number. That I cannot give you, Kelly.
Okay.
I wish I could, because if I could, you know I would.
Okay.
I have taken the state so many times, I even know more or less the questions they give you. And I do that and I go over a nice review for the state with you at the end of the course, I will probably sit with all of you via Zoom again, and we will go over state test questions. Exactly more or less what they're going to give you on the state. The hell is this thing at? Sorry, 1 minute. I'm trying to find my paperwork here. You said airway, right? What chapter is 11? Okay, we're talking about airway again. You know how it always starts. I always tell you this, the national EMS standards and so forth, competencies and what you should go over and know to do a book. Airway anatomy, airway assessment, techniques of a patent airway. Remember that patent airway is always a test question. You got to know that, okay? We'll go over all this also. We'll talk about all these words and the respiratory system. Given oxygen, you need to know that. It's always test questions. Inadequate and adequate respirations and when to ventilate. You're going to hear me say certain words. We'll talk about alveoli ventilation, minute ventilation, artificial ventilations, things like that. And the pathophysiology of it when they talk about respirations and perfusion. It always talks in your book about the introduction. You need to know the introduction when you read that. Always read that what it talks about. We definitely need to know the word diffusion. In your book, you're going to see that word, highlight that, diffusion. I need you to know that's the higher concentration to the lower concentration. Okay, you need to know that word, diffusion. Okay, and we'll talk about the process of molecules moving from a higher to a lower. Okay, highlight that. So I want you to think of like the exchanges of gases and so forth with the carbon dioxide and the oxygen. In case they ask you that, you know it. This, I'm going to show you what's always test questions here. Be prepared for this, okay? Here, they want you to know the upper airway. The upper airway, they always ask you this here, more or less, the epiglottis. You need to know what's the epiglottis. They'll use words like leaf-like flap, okay? Epiglottis, what does it do? It prevents foods or solids going down the trachea. It's supposed to go down the esophagus. So that's why the epiglottis is there. So know that word epiglottis when you see it. They're going to ask you that. Make sure you know that leaf-like. Over here, they'll ask you about the upper airway and what sounds you hear when there's a problem in that mouth, okay? Number one sound you hear when there's a problem is snoring. It's because the tongue got so loose and flap and went back and blocked the airway. Don't believe they can swallow their tongue. That's BS, okay? They cannot swallow their tongue. So I want you to know the word snoring. If in this upper airway, there was fluid or blood, and of course you needed to suction, you'll hear words and the sound called gurgling or gargling. Gurgling or gargling. Make sure you know that word. That's very important to know also. Now, another word you must know that you always see on exams is called the sound to do with stridor. Stridor, upper airway. Okay? That upper airway sound is when they breathe inward. So when let's say I have the blockage there and I have stridor, it's going to be a high-pitched musical sound or a ka or crowing sound. Stridor. Think of some kind of blockage occurring in the upper airway, or if there's a person in anaphylactic shock, think of the word to do with angioedema. Angioedema. Okay? Angioedema, you think about the face and the neck swelling and so forth. So you know if that's swelling, the inside of the mouth in that area is going to be swelling also. So it's called angioedema. Make sure you know that in case they ask you a test question on that. So we had some sounds here. That's the upper airway. When it comes to sounds to the lower airway, you must know these. The word wheezing, lower airway, wheezing, okay? Document that wheezing. Know that's the lower airway, and that's upon exhalation, breathing outward, that patient. I think of the wheezing sound that's occurring because the bronchioles are constricting, inflamed, and maybe have some form of mucus. Okay, so make sure you know that word, wheezing. You see a lot of that in what type of patients? Pneumonia patients, asthmatic patients, COPDers, chronic obstructive pulmonary disease, maybe even certain cancer, lung cancer, or something else that's going on with the patient. So know that just in case, the word wheezing. Another word you need to know for sure is called rales or crackles. Rales, R-A-L-E-S, or crackles, okay? The ones who have hair, take a piece of your hair and put it next to your ear with 2 fingers, okay? When you do that, I want you to go like this with it. Okay, so a piece of your hair next to your ear, the opening, go like this. And you hear that sound? That's the rales or the crackles. That is fluid in the lungs. Fluid in the lungs. Another word for fluid in the lungs is called pulmonary edema. Pulmonary edema. Okay? And then another word for the lower airway you may hear, like a congestion or noise, is called rhonchi. Rhonchi. Okay, so make sure you know that in your book. Okay, make sure you write that down. It's good notes to have. Trust me on this. You know I'm going to guide you to make sure you do well on your exams, and I really want you to understand this material. Now, they may ask you, what is this right here? Here is your diaphragm, that muscular dome. They're going to ask you in order, when you breathe in, what type of process is that? So if they ask you the 2 types of process, if you do not see the word inhalation and exhalation or inspiration and expiration, then look for the word active and passive processes. The active process is when you inhale, okay, or inspiration, okay? The passive process is when you exhale or expiration. You need to know the process. You need to know what and how the air goes down to your lungs. You have to be very careful how they ask you these test questions. Don't read into it. But if I ask you, when you breathe in, what muscles and what's going on will contract and expand? These ones you need to know. So if they ask you, you're breathing in, and you see that you're in that active process of breathing, the main ones they always talk about is that diaphragm. You need to know that that's the primary muscle. It contracts downward, and the intercostal muscles go up and outward. So the diaphragm contracts downward and flattens, and your rib cage and the intercostal muscles go up and outward. You need to know that. You notice I didn't ask, all of these will help with your breathing process. Give them all to me. If they were asking questions like that, all these are when you breathe, what muscles do you use? Well, technically you use your intercostal muscles, your abdominal muscles, your pectoral muscles, your diaphragm. You see the difference of the question? You have to know that. Make sure you can separate those 2. Okay? In order, when you breathe in, descending, meaning going down, or superior to inferior, this is the order you need to know the lower airway. You need to know that it starts with the trachea, that air going down. Then it goes to the right and left bronchi. You could say right and left main bronchi. That's the words they will use. Then it goes into these words. You see these here? Called bronchioles. You need to know that. And then into the alveoli. So I'll say it again. Trachea, okay, goes down to the right and left main bronchi. Then to the bronchioles, and then to the alveoli where we exchange the gases. You must know that. It's very important, please. Okay. Understand that you should be okay. That's in order. So if they ask you a test question, the order, you know how to break it down, right? They will call these alveola, okay? Air sacs, alveola, alveoli, all means the same thing. They will use that word diffusion, higher concentration to lower concentration. You know exactly what they're trying to say. If you see a word that says respirations, they mean the exchange of those two gases at the alveoli. If they say the word ventilations, the ambiance air right in this room where we're at, to your lungs. No problem, Christian. It happens. It documents you in and out, so it's okay. As long as you're back with us and you're here and all of you are learning and you and so forth, and you understand, I did my job. You're okay. Just want to make sure. Okay, so
Thank you.
You're very welcome, sir. Let's continue here. Just give me 1 minute. Something happened to my thing that I have to. There you go. I got to get used to these computers. They ask you this part here. That little piece is called carina. That's when it splits both main bronchi, right and left, or they use the word bifurcates. Bifurcates means splits. Okay? Just in case they ask you that. So you know the upper airway. You're going to see things like this in the upper airway. We're going to go to this real quick. You know how it divides it. Nose, mouth, oral cavity, pharynx, and larynx. It's each in your book. Highlight that. Makes your flashcards, whatever you do. Just know it in case they ask you. If they ask you here goes a test question right here. The upper airway main function is to warm, filter, and humidify air as it enters the body. Okay, you need to know that. If they talk about the pharynx, okay, make sure you understand that. Muscular tube that extends from the nose to the mouth to the level of the esophagus and the trachea. They ask you that. And then they're going to ask you, composed from top to bottom, the nasopharynx, the oropharynx, the laryngopharynx, okay? And then it breaks down each one. There's a nice diagram in your book on page 419, right-hand corner bottom. So what you should be doing is highlighting nasopharynx, oropharynx, on that page, on 418, what we spoke about before, on 420, the larynx, okay? And I'm going to show you these that you need to know. They always talk about these. If you notice this, that's your pharynx, this whole part here. But they break it down into like 3 sections, okay? They ask you anything, nasopharynx, oropharynx, laryngopharynx, you know it, highlight it. Nasal filters, dust, small particles, okay? Warms, humidifies as it enters the body. That's your nasal pharynx, if they ask you that. If they talk about the next one, the oropharynx, posterior portion of the oral cavity, then this you definitely need to know, that word, epiglottis, okay? What does that epiglottis do? It helps prevent food and liquid from entering the larynx during swallowing. So it wants the food to definitely go down, or the liquid down the esophagus, not the trachea. Make sure you know that. That's important. Okay? And that's how it looks here. It's in your book. You can look at the picture. This you must know. They're going to ask you a question on this. They always like to bring this out. Okay? And you need to know these pieces, how they break it down. The thyroid cartilage, okay? The cricoid cartilage. They may give you words like hard, rigid, or circular ring. That is your cricoid cartilage. Your thyroid cartilage is right here. Make sure you know that word in case they ask you that, okay? Just in case. This I've seen on test questions. They will always ask, this located in the larynx, vocal cords. I've seen that before. Okay? So you know the thyroid, okay? V anterior, aka the Adam's apple, okay? That's where they talk about the thyroid cartilage. The cricocartilage, the first ring of the trachea, and then the cricothyroid membrane is that piece of membrane that if they needed to create an airway, they would cut that open right between those two, and that's up here. Okay, we're not talking about the trachea. We're talking about this piece here. So make sure you know that that is totally separate from the trachea. And then in order, exclude these lungs. I want you to make sure what I said before. Trachea, right and main bronchi, bronchioles, alveoli. Okay, know it that way, please. Very important. When I show you the picture, you're going to understand. There goes your trachea. We spoke about this. We spoke about the right and left main bronchi. Here it goes. This is the easiest way. So if I ask you a test question, just picture this. The air comes down here, right? Goes down to trachea. It goes to carina. Okay? When it bifurcates or splits, whatever word you want to use, you can use it. It goes down to the right and left main bronchi. Then it breaks up into these bronchioles. And then it goes into little corners of all these, which the book talks about 700 million alveoli. Okay? And that's how it exchanges the gases. Okay? Make sure you know that. So is there any question in the order you need to know this?
Can you repeat it just one more time?
Of course, Kelly. Come down the air, the trachea, to the right and left main bronchi, then into the bronchioles, and then into the alveoli. Okay?
Okay. Got it.
I'm going to give you guys at least what? How many minutes you want to take a break? Because I have to eat something. And I know you have to eat something because I got an excuse. I'm diabetic. How's that? So I definitely have to eat something, right? I kind of like that. He said, that's Nuki excuse, right? Yes, I'm going to eat something, 10, 15 minutes, and then we'll finish all this.
Okay.
I know there's a lot to do, but before we leave tonight, you will have a lot and be prepared for the coming exam. So how many minutes? Talk to me. Someone say something. Put it on the chat.
你10don't sound bad, you know.
Okay, you know what's going to happen. I'm going to say 10 and you're going to take 15. So let's do the 10 and you know we're going to be back like in 15 minutes, okay? It's 7:40, okay? Okay. Where is this? Stop. Video.
Recording stopped.
Okay, I am back. You see this space in between the both lungs? Are there actually any test questions on this, especially you do with airway? You need to know this space called the mediastinum. Mediastinum. State-wise, these are the parts I always see on tests in the state. You need to know that it's the heart first, the great blood vessels, the trachea, the esophagus, and the thymus. That's pertaining to the state. That's what I see. So make sure you know that. If they ask you how many lungs you have 2 lungs. How many lobes you have 3 lobes on the right and 2 lobes on the left. Mediastinum, John. Mediastinum. If you want to know where that word is, let me find it for you. Page 422, right-hand corner bottom. Mediastinum. Highlight that, make sure you know that, okay? You're welcome. Those are the 5 I see on the state for sure. Okay, so know that. So getting back to the lobes, 3 lobes on the right, upper, middle, lower, left, upper, and lower. That's it. That space in there is where the heart sits and so forth. Okay, you need to know that in case they ask you that. We already went over the trachea. There goes the mediastinum. This is what your book says. You can highlight that in your book, but definitely want to write down what I stated, okay? We know exchange gases when you breathe, carbon dioxide and oxygen. These words are always on exams right here. Highlight that in your book. Now, in your book, it will talk about this on page 423. On page 421, you're going to see a special population. It talks about the tongue and so forth and the mandible and things like that. They always like to give you test questions to do with the A and P and the difference. So please make sure you look at special populations in your book, words of wisdom and things like that. Okay? That's on page 423. Excuse me, 421. And 423 is this. You know this already. Remember I said the word respirations, ventilations, oxygenation. This, if they ask you, you need to know that right there. It's very important that you understand that, okay? Now, when you see these test questions, it's how they're going to word them, and you have to know the difference. So make sure that you understand the different devices. That ventilations, if I tell you I needed oxygen, what are the main two devices you're going to give me maybe to give me oxygen? I say, oh, I can't breathe. Kelly, I can't breathe. I need oxygen. What are the two devices that comes to your mind? Any one of you, if Kelly can't answer.
The air
Nasal
bag.
cannula is one of them. What else? What's another one they talked about in skills?
Nasal one.
Nasal is one of them. And what's the other one?
The
Non-rebreather.
Non-rebreather. All right. The NRB. Right. And they talk about that. That's when I say I need oxygen and you give it to me. But if you're going to give me a form of ventilations, there's three main ones that the book in this chapter talks about. What are those three? Can anyone name any of them? Okay, write this down. Pocket face mask, BVM, CPAP. Pocket face mask, BVM, which is bag valve mask, and the CPAP. You need to know all of these devices, okay? Always I see on test questions is to do with the nasal cannula. They probably taught you 2 to 6 liters in skills. I always mention 1 to 6 liters because that's what I see on exams in the state. They'll ask you how many 6 liter is and what is the percentage. If you know 1 to 6 liters, you know it's 24 to 44% that device gives out. Okay, 1 liter is 24%, 2 liters is 28, and so forth. It goes up every 4. You need to know that. Okay, that's your nasal cannula. If it's your non-rebreather, they say like 90 plus. Okay, and they tell you to administer like 10 to 15 liters. That's what the book says also. Now, those are the two that comes to mind. But if you're going to use the other 3 devices, pocket face mask, I want you to know that if you're breathing in and you're utilizing that device with no oxygen and it's just you taking in a deep breath and then ventilating the patient, you're giving that patient 16%. Because when you breathe in, it's 21, 16% comes out. Now, that's your pocket face mask. If you hook it up with oxygen, it could be anywhere like 50% plus, okay, dependent. Now, the next one you need to know, always test questions, the BVM, bag valve mask, okay? When you're giving that oxygen, well, if you're giving oxygen to the patient, utilizing the BVM by itself, nothing attached, okay? It's the same 21% in the air that you're given. But when you start hooking up with other devices on it, like the oxygen tubing, the reservoirs there, and everything else, it increases. Okay? You should have received a nice handout that I sent that describes those oxygen devices and the percentage. Okay? Look at that when you get a chance. That will help you a lot. So the next one is CPAP, another forms of ventilation. That CPAP, look for the words that says forces all the way down to keep the alveoli open. In other words, That CPAP brings the air down here and it forces whatever's in its way, fluid or mucus, whatever, moves it to the side and goes straight to the alveoli because it needs to keep it open and functioning right so you can have the good exchanges of gases, good elasticity, good contractions. So look for that word force. I see that word utilized a lot on test questions. So you got this already. We already went over ventilations, inhalation, and exhalation. Okay, we spoke about that. This is what you need to know. This hypoxic drive, always a test question. You need to know for you and I to breathe normal right now, we must have an increase of carbon dioxide in the arterial blood. Okay, so right now everybody's breathing normal. Why? Because the body, the heart, the aorta, and your carotid arteries sense an increase of carbon dioxide in the arterial blood. It mentions the pH. I have yet to see that on test questions. That's why I always stick with what I know and what I see. Increase of carbon dioxide in the arterial blood is picked up by where your aorta is, the sensors or receptors, and the carotid arteries on both sides that picks that up. And then it lets who know? The brainstem, the one that controls oxygenation, right? Oxygen, right? Your breathing pattern, okay? How you breathe. It tells the brainstem, hello, I need you to let the diaphragm know what's going on. So it goes in order. The brainstem is notified. The brainstem sends a message down to the pharynx nerve. The pharynx nerve sends a message to the diaphragm. And guess what? You're breathing normal, like you're breathing right now. If for some reason you have some kind of cancer, emphysema, bronchitis, whatever it may be, that you have to work on low levels of oxygen, that is your hypoxic drive. That's your backup. Okay? That's the easy way to say it and go with it and know it. In case they ask you a test question, you can answer it easy. Okay? Remember, we do not store oxygen. It's constantly moving. It's constantly exchanging everything. Okay? Just in case they ever ask you something like that. So we know oxygenation, we went over that. Respirations, we went over that. Nebulizer treatments, CPR, you're probably going to learn if you didn't go over that. Nebulizer treatments is for like asthmatics, pneumonia, things like that, people who are wheezing, probably COPD is. Endotracheal intubation is when a tube is being, being put down the patient's trachea. And the CPAP we just spoke about also. You know this is a test question right here. You have to recognize this. You have to recognize adequate breathing. Anything other than adequate, there's a problem. You need to know the names. I'm going to say it. You need to know a word called chain strokes. When I get to it, I'm going to tell you to highlight that. Another word called Kussmaul's respirations. Okay? Chain strokes, you think of a person having a stroke or trauma. Chain strokes. Up, down, absent. Up, down, absent, chain strokes. Think of those two types of patients. Also, that head trauma. Then you look at Kussmaul's respirations, deep and rapid, diabetics, sugar very elevated. You better know that, okay? Those are ones that are totally inadequate respirations. But you notice here, when it's adequate, you have a 12 to 20 breaths per minute. You have a regular pattern when you inhale and exhale, active and passive process. You have bilateral clear lung sounds, okay? The chest rises and falls. You got good tidal volume every time you breathe in and out in 1 second. It's excellent. Once you see a reduction or reduce in tidal volume, you know that's a problem. That's when you look for the words like shallow respirations, right? You look for labored breathing also. That's when you know it's not correct. It's abnormal. There goes your abnormal ones. Numbers lower than this, higher than that, depending. There's no rhythm. Good rhythm is irregular. You have diminished or absent sounds, okay? reduced flow of expired air at the nose and mouth. This is given you to let you know something's wrong. So a test question would be, say, patient is unconscious, lying supine, unconscious or unresponsive, and they're cyanotic or pale, cool, diaphoretic, and they have this breathing pattern, deep and rapid. Okay, you're saying deep and rapid. Kussmaul's respirations, diabetic, probably elevated sugar, and so forth. This is how you can determine more or less with signs and symptoms what's wrong with your patient. And then goes, you're recognizing the abnormal breathing and it continues. Everything we spoke about before and I mentioned directly from your book. And then you're going to see the chain strokes and you're going to see the Kussmaul's respiration. So know this in patient assessment. So in your book, 423, you go to 424, 425, you know the inhalation, exhalation. 425, there's a nice ventilation terminology. Highlight that. The words I always see a lot on exams is tidal volume, residue volume, minute volume, dead space. I see that a lot on exams. Okay? 1, 2, 3, 4, 5, 6, 7. So you got 1, 2, 3, 4 that I constantly see on exams. I just mentioned it to you. Here goes your chain strokes. That's your stroke. That's your head injury. That's the breathing. You notice it goes up, down, absent. Up, down, absent. Okay? It's totally irregular. Okay? There's something wrong here with the chain stroke. So breathing shows irregular respiration followed by a period of apnea, no breathing. Make sure you know that, highlight that in your book. Okay? For all that, once you pass and highlighted the other sections of it, I want you to go for that. And I think that's in page, I'm going to find it for you. 432, recognizing adequate breathing, abnormal breathing, and 433. You definitely want to highlight these and look at those bullets. It will tell you a lot of information there with a tripod position and so forth, and unequal chest expansion. And you see a word called accessory muscles, and then another word called retractions. Highlight that. Retractions you'll see a lot when the chest is caving inward. It's called sternal retractions. You see that a lot on infants and pediatrics, okay? And then a word called gasping. Bottom right-hand corner called agonal gasps. Highlight that right there. You should be aware that the patient may appear to be breathing after his or her has stopped. This occasionally gasp breaths are called agonal gasps. In other words, the heart has stopped, but the brain is still sending out a message, okay? Because remember, with lack of perfusion, when is a possible brain damage? 4 to 6 minutes. Remember that? Possible brain damage, 4 to 6 minutes. Likely brain damage, 6 to 10. Irreversible brain damage, 10 or more. These are numbers you need to know for the future. Okay, so know that word, agonal gas. Chain strokes on 434. Apnea on 434, left-hand corner. And there goes your Kussmaul's right here. Deep and rapid. Think of diabetics, okay? That's always I see. Any questions so far? Okay. You know, in your patient assessment, I think it was chapter 10. When you go to that chapter 10, you know it's going to be from the scene size up to your primary assessment, your ABCD, everything you normally do in your primary assessment. Your secondary begins with history taken, and then the vital signs, everything's there. If it's medical, you know it's the sample, the OPQ, STI, and so forth. Physical exam to do with the body system, and then the ongoing assessment, or what we call reassessment. That's to do with patient assessment. The pulse ox, what numbers I'm looking for pulse ox that I should have? What numbers to what? Blank?
94 to 100.
That's not. I want you to go for 94 to 99. Ignore that 100. Okay? Ignore that 100. There could be definitely an error there because they're going to ask you what a few things are that would give an irregular, a bad reading on it, wrong numbers. You know that the pulse ox does what? It measures the percentage of the hemoglobin saturation. You need to know that. They want you to know it should be 94 to 99. They're going to ask you more or less what can cause wrong numbers, not the correct percentage. Hypothermia, okay? Hypovolemic shock, nail polish, dark in color, red, black, and so forth, okay? And carbon monoxide poisoning. Those are the 4 I always see out there when they give you tests. Okay, trauma and medical, opening up the airway. You open up the airway, medical, head to chin lift, and trauma, jaw thrust. You probably went over that and did it. Have you guys did skills in airway? Yeah.
Yes, Dad.
Okay, so a lot of this you know already, so I'm not going to go too crazy on this, okay? If you have a question, you stop me. Head to chin lift, you know that. Jaw thrust, you know. Okay, open up the airway, that head to, or that cross finger technique. That's when you go like this, and it turns, you use your index finger and your thumb. You put it the opposite direction, and it goes like this. So it's opening up the airway. Remember that? Good. There goes your jaw thrust. And then suctioning. Always test questions here. They're going to ask you suctioning questions. You need to know each of these different devices. This is a handheld one that, is not like battery operated or onboard. Like this one here is the onboard. This one is the portable. This is the one that you carry with you after it's charged in your ambulance and you take that to the patient's home. You need to know all these. In case they ever ask you a question on it, is how you measure this part here. On these, it's separated. It's called the tonsil tip Yankawa hard or rigid catheter, okay? That's that piece of plastic that you see. It looks like a hockey stick, okay? Those are the 4 names that I know that are given to it. You need to know the numbers of how long you would suction that patient for. 5, 10, 15. Let me know if the numbers have changed. 5 for the infant, 10 for the child, 15 for the adult. Did the numbers change or they're still teaching you that way? Still the same? Beautiful. Okay. 5, 10, 15. Thank you. Beautiful. So you measure it. Okay. Then you go in as far as the eye can see. Once it's in there, you put your finger on the vent and it's in there and in a circular motion on the way out. Withdrawing. That's the words you're looking for. You suction a patient. Be careful because if you're too long in their suction, you could cause a form of hypoxia. Okay? Make sure you know that in case you see that on the test. That suction power on these machines, these 2 especially, the onboard and the portable, must be 300. They normally use a word or they have a little dash named negative 300. Make sure you know that, okay, for that vacuum. Has to be that 300. All right? They'll show you how to test it. It's easier. It's not that hard. Some people tell you to put your thumb on that tubing, turn on the machine, with your glove hand on. It all depends how they tell you and how they test you. Some instructors will tell you to kink it, whatever which way they taught you, just go by that, okay? There goes that plastic catheter, okay? that tonsil tip, okay, make sure you know that. There's a few names for that. The tubing it comes with. We spoke about that. That's the number I need you to know. That's always test questions right here. Make sure you know that number. This, you know, the 5, 10, 15, we already went over. And there you go. Suction can cause resulting in hypoxia if you do it too long. When patients have secretion of vomitus, it cannot be suctioned easily. Remove the catheter, roll the patient to the side, clear the mouth carefully with your finger. And you know me, I don't think I'm putting my finger in their mouth. I'll probably use the same catheter and just use the catheter. You know, what if they wake up or they try to bite my finger? I'm not doing that. You know, they want you to do the finger, they tell you to do it, but I normally used to use my glove hand and then take the catheter and go like that. I didn't want to stick my finger in their mouth, you know, but you can. Okay, airway adjuncts, always test questions. So when you go further and you see these on the chapter, we went over each one on the PowerPoint presentation. That means if you want to read it again, you could go for each of the pages, starting from the pulse ox on 435, 436, 437, 438, 439, 440, and 441. 442 and 443, that gets into the suction equipment. 444, 445, and 446. 446, bottom left corner, bunch of test questions there. How do you measure an OPA? OPA, oropharyngeal airway, two ways they said I've spoken to you about. Corner of the mouth to the earlobe. Corner of the mouth to the earlobe. Or the center of the mouth to the angle of the jaw. That's two ways they should have taught you. It's up to your senior instructor, okay? And your skills instructor. Know that OPA, two ways of inserting it, 180 and 90. Make sure you know those numbers, okay? The hard palate facing, the curvature facing the hard palate, turn it 180. The flange should be flat against the lips, okay? So this is the OPA should be like this. If they say you have to remove it, okay, depending, it will be anatomically. But if the patient starts to vomit, okay, they want you to turn that patient quickly to the side, suction the vomit off or let it come out and then take out the OPA, okay? Because it's a quick thing. You don't want them to aspirate. That's why you don't automatically, they vomit and just take out the OPA. You turn them to the side, try to clear out all their vomitus, and then take out that OPA. That's according to your book also, right? Then there's the MPA. Oh, excuse me, let me go back for a minute. We did the 180, I forgot the 90. Let's say this is the curvature of the OPA, oropharyngeal airway. It goes to the inside of your buccal area, inside the cheek. And then you turn it 90 degrees. What is the main job of that OPA? To keep the tongue down in place, okay? That's the main job. Now the MPA, state test question always. Tip of the nose to the earlobe. Tip of the nose to the earlobe, NPA, nasopharyngeal airway, or the septum, right here, the septum to the earlobe, National Registry. Okay, so make sure you know it both ways in case they ever ask you that. Now, once you have that NPA, it must be lubricated with a water-soluble solution after you measured it. And then it has to be inserted with the bevel facing the septum in the right nail first, in the right nostril. So you go like this and easily put it in there with two fingers. If you lubricate it properly and measured it properly, it should go in with no problem, okay? Some people tell you to turn it 180. All my years experience using that, it contours with no problem. You know, some people say turn it 180. Once I put it in, it finds its way, okay? If you feel resistance, they say go to your left nostril. Possible test question. You got to relube it. So make sure you know the OPA and the MPA, and you know the suction. There goes that gag reflex. I want you to know that we spoke about that. The nasal, we spoke about it. They said be careful with head injuries. They don't want you to have that's contraindicated or something wrong with their bone and their nose, severe facial injuries. You don't want to insert that MPA. Okay? Could probably go right to their cranium. That's what they talk about. They also probably taught you, you could use the patient's saliva, or you could look at their nose, their nail, the size of the patient's pinky. That's old school. They probably taught you that also. And then what position is this?
Left lateral recumbent.
Left lateral recumbent or recovery, right? Or coma position. You need to know that. Okay? That's that position. Left lateral recumbent or recovery position or coma position. That's old school. Okay? We're going back now for the 70s and 80s and 90s. They used to use the coma position. And then they said, no, it's recovery position, left lateral recumbent. You may see it on the state. You never know. Now you went over oxygen. Okay, I have the oxygen tank. It's a D-sized tank. They probably went over this with you in class. I give it to one of you and I say, Alejandra, tell me about this O2 tank. I just gave it to you. What will you say to me? I just gave you the tank.
We have to open up the key.
Okay, the oxygen key.
Yeah.
So you're going to open by cranking it a certain way. That is good. But before you crank it open, tell me about this oxygen tank. I just put it in your hands. Tell me about it. Besides opening it up with the oxygen key, if you see USP, what does that stand for?
SUS. I'm not quite sure.
Okay, it's all right. That's why we're here. United States Pharmacopoeia. Oh, this oxygen tank is USP. This is oxygen. It says oxygen. Okay. And what else? Well, oxygen, it should be green in color totally, or it would be a green collar with silver. And what else you could tell me about this tank? Well, the oxygen, it also has this prongs here, or these holes here that to do with a pin index safety system and so forth. Besides you crank it and open and everything, you need to know a little bit about that oxygen tank. When they give you and test you physically, they're going to ask you, okay, here you go. What do you know about this oxygen tank? Just state what I just said, what that instructor taught you. If they say, why does that regulator or that flow meter only fits on that oxygen tank? Because the PIS system, pin index safety system, it's the only way that a regular flow meter or a regulator will fit on that oxygen tank because it's made because of the pins. In your book, you're going to see these pins. Okay, they give you a number. It's like 2 and 5. You cannot put a nitrous oxide or helium tank regulator on an oxygen tank because of that pin index safety system. So these are things you need to know. Now, once you crank it open and so forth, and you take out the debris and everything, and you apply that regulator, you need to know what are the PSIs for the full tank. How many PSIs? 2,000 plus. 2,000 plus PSIs, full tank. You must know that. When do you exchange a tank when it starts going down on those PSIs? 500. 500 or less, you're exchanging those tanks. State, maybe class question here also. What is the minimum safe residue that you could let it go no further than now? It's 200. But sometimes you could be on scene for a while and it goes below 200. It goes to empty. That's kind of because they're going to get all that nastiness and that gook from the bottom, because on that O2 tank, if it's a steel tank, it's going to be very heavy and it's going to have an asterisk next to it. It's very heavy and it's a steel tank. If it's an aluminum tank, the ones you probably do a lot in class with and work with, that's aluminum. It's kind of light. You need to know about it. And if it's painted on the date, that aluminum tank means that it was hydrostatically tested. Okay, they test those tanks so they can refill it. So you need to know that oxygen tank and why we use that drug, okay? Any questions so far on the oxygen tank, even when you crank it and so forth. Remember, don't leave it standing up. So we know about the oxygen tank. We know about the size tank that we utilize. You need to know the other letters. They may ask you, what's the E, what's the M, what's the G or the H. 2,000 PSI. Just remember that when it's a food tank. Okay? Does it have more volume in it and so forth? Yes, that's different depending on the size. Okay? But when you have a food tank, should be 2,000 plus PSIs.
What is a liquid oxygen?
Liquid oxygen, explain that to me. What is liquid
Can you go back to that slide, the one you just passed? What's
liquid
liquid
oxygen is becoming more common use alternative. I am not sure what they mean by liquid oxygen. I do not remember it. Google it for me.
When oxygen is under enough pressure, it becomes a liquid,
Oh,
but it boils at room temperature and becomes a gas.
Oh, okay.
thank you so much. That was you, Jason?
Yeah.
No problem. Thank you very much. That went right over my head. I appreciate it. Every day I learn something new. And even if I forgot it, thank you very much. And I'm glad he was able to answer your question, Kelly, and to the rest of the students. Okay. You know, it's a D size tank. I'm not trying to make funny here, but you're going to see, they're also going to say there's the double D or the jumbo D. They're out there. Okay. Tank wise. Okay. There's the E you see a lot on the wheelchairs or underneath the stretcher. The M tanks, you see those tanks probably in the ambulance underneath the bench. Those big, huge H tanks are huge. Okay, steel. They're on the side of the ambulance. So it all depends where and what they have from inside the ambulance or outside the ambulance and so forth. Just remember the other ones we spoke about. That you need to know, PIN safety system. Those flow meters or those regulators, it's the ones I talked about before. This, they may give you a test question, oxygen toxicity. I have yet to see and dealt with this that unless it's far transportation for hours and hours and hours on a COPD, or let's say, that it will kill this patient. It's saying that if you're giving oxygen constantly to these types of patients, excessive, that it could be, I think they use the word detrimental to them, okay? That it could possible they could cease breathing. All my years with EMS, I have given 15 liters to these patients, if not a nasal cannula, if they can't tolerate the non-rebreather, but never seen them or had them die in front of me, okay? Has to be very, there for a while. Thank you, Devin. Appreciate it. I think Jason should be able to answer that for you. Jason, do you see it on the chat?
1 second. With
When you click
yeah. My point is that, like, by the time, room temperature is a lot warmer than negative 300 degrees Fahrenheit. So
Yeah,
I just meant, but
yeah. No, you're right, but that's why it's so uncommon, because it takes a lot of energy to store it at negative 300 F.
Yeah, exactly. But the nice thing is you can store so much in such a small space that it needs to be refilled so rarely.
have they started using that already in certain places?
They mentioned in class that, at longer term facilities,
It's becoming more common.
Yeah, exactly. But
Yeah,
I don't think they would ever use it on like an ambulance or.
Okay, like on the
EMS.
hospital setting.
Yeah,
Exactly.
it's a hospital setting. I think just recently, because I also attend engineering school, I heard some professors talking about some sort of breakthrough with it, but I can't remember what it was.
Okay, it's good to know. I want to thank you all, for teaching me something. I appreciate it. I really do. And hopefully that helped you, Kelly, also, like about the liquid oxygen, right? Because if I knew it, I would have told you, yeah, that's what this is. And I didn't. That's why. So when one of you stated it, thank you very much.
Yeah.
Okay, the non-rebreather, the BVM, the nasal cannula. We went over these. Okay? There goes your nasal, there goes your non-rebreather. We spoke about this. There goes your nasal cannula. These are the numbers I want you to know. Always see these on test questions, okay? I do not see the partial rebreather mass on it. It says it's similar to the non-rebreather. This I seen on state questions. This you need to know. This is your Venturi mass, okay? I don't know if they showed you this in class and they had these adapters and each one of these are a certain percentage. And I remember these being used a lot for COPD patients, okay? Because it turned out a certain percentage out. So make sure you know that and understand that. In case they say Venturi mass, if you go over the skills again, and they show you that, that's awesome.
What's
Okay.
the flow rate of the Venturi masks?
Oh, it tells you on it because when you put on the oxygen, this will correct that percentage. So it could be similar, like say 10 to 15 liters.
Mhm.
Okay. And then this will put it to exact what's going to go out percentage wise. I'll try to find out where's that.
14 liters per minute.
That's what it says?
Yep.
Okay. Did you get the page so all the students would know? Oh, got it. 459. Where did you get the 14 at?
Sorry, 12. Yeah, dude, my dyslexia is really bad. I
can't-
Googled it.
Okay, that's nice. Right. If not, ask Professor Google, right? Or my wife. Just joking. Just joking. Thank God she's not here with me. She'll kill me. Because I say, I thought you knew this. You know, you and Google, Professor Google know everything. She wants to beat me up. This you must know. This is what they call to do with tracheotomy, and you may see this mass. Okay, if you do not have this on your ambulance, if they don't carry it, can you still suction and ventilate a patient who has difficulty breathing through the stoma, through that hole, that opening? Normally, you would see they would do like some form of tracheotomy. Okay, if they can leave that hole there, that stoma, you could suction through there. Sometimes your rigid catheter would not fit there, the Yankawa, the tonsil tip. So you would use the flexible tubing called the French catheter. Okay, it's very flexible. You could use that. Okay, make sure you know that. If you are ventilating that patient, let's say they do not have a tracheotomy tube. That's a tube that goes down that opening, that stoma. Sometimes if they do, you can easily ventilate it because that hole, that device looks like this, and you could put your BVM right over it because it has a 1522 adapter that fits right over, and you could ventilate the patient down that tracheotomy tube. But if they don't, you can still ventilate them with your BVM, but you got to find a very small size mass, put it over the hole, and then ventilate the patient. Test questions they love to give you on this is, can you ventilate a patient who has a stoma? Well, the answer is yes. But then they ask you this. If the patient, when you ventilate, every time you squeeze the bag, that BVM, the air is coming out their nose and mouth, what are you supposed to do? You seal it. You seal the nose and you seal the mouth, and then you squeeze the bag. Then the air will go down. Make sure you know that.
Don't do it in public. People are going to think you're killing them.
Yes. It's kind of funny when you see that. Kenneth, I got that. Oh my God, you are too much. Thank God the wife's not here. Okay, but now you know about this tracheotomy. All right, she's in the other room. Okay, we went over BVMs, system techniques. Never do mouth to mouth, please. Use some kind of barrier device. Use your pocket face mask or something, but you should not be doing mouth to mouth unless it's your immediate family. Okay? I would do mouth to mouth on my wife, my mother-in-law, you know, my grandchildren, my son, my daughter, things like that. But my cousin who lives in Louisiana comes to visit, and he goes into cardiac arrest. I'm doing hands-on CPR. But Nuki, why you didn't put your mouth to mouth? That's your cousin. No, I'm sorry. He's probably going to die because I'm done doing mouth to mouth. I don't know where his mouth been at. Sorry. I know you people are smiling saying, Nuki, you are so cruel and wrong. But no. Okay, 1 or 2 person background mask. Yeah, I'll use the BVM pocket face mask. Remember, the pocket face mask has a one-way valve. If you're sick, okay, Maria, you're sick, let's say. I'm just making believe. Maria's sick and she wants to give her family member mouth to mouth, not mouth to mouth, the one-way valve with the pocket face mask. But she's sick. She has a cold. Okay? She breathes in there. Whatever she has, that family member or friend, whoever she ventilated with the pocket face mask, gets it. Whatever they get now, they keep. You follow me? Because that one-way valve. So know that that one-way valve is very useful. Okay, let's continue. There goes your BVM. Gastric extension, always test question. Too fast, too forcefully, is going to cause gastric distension, okay? Be careful with that. You want to give slow, gentle breaths during this ventilation, like 1 second. Okay? Depending how much you're giving, depending what type of patient you have. If you're giving 2 ventilations to a person in cardiac arrest, 30 compressions and 2 ventilations, okay? If you're doing rescue breathing, that's different. Okay, if you're giving 1 breath every 5 to 6 seconds, 1 breath, 1001, 1002, 1003, 1004, 1005, squeeze. See the difference? Make sure you know that. If it's a pediatric or infant, I think they're still doing, according to the new American Heart Association, 1 breath every 2 to 3 seconds. They changed it. It used to be 1 breath every 3 to 5. So know that number, 1 breath every 2 to 3. Does LaGuardia still have the ATV? Did they show you the ATV? No? Okay.
I don't think so.
It's a device, automatic transport ventilator. It's a small machine. Well, it's just like a machine and a ventilator at a hospital, just portable. That's all. I thought they had it. I could have sworn they had it for the medics there. There goes your CPAP. We spoke about that. Make sure you know about the CPAP. Remember, continuous positive airway pressure. If I was to say a patient like myself, I'm on CPAP. I have sleep apnea. But let's say I have COPD or I have pulmonary edema, you know, you're going to utilize the CPAP according to protocol. Make sure you know that. Okay? Very important on that. There goes your stoma and tracheotomy tube. That's that hole, that opening. Airway structure. Have you guys done CPR yet? No? Okay. If I didn't send it to you yet, please remind me to send it to you. I have a nice sheet that covers a lot to do with the CPR. Okay. I call it the little cheat sheet. Okay. It's nice. You'll like it. Okay. Tells you a lot to do with CPR. We spoke about the tongue blocking the airway. That's the universal sign of choking. They'll tell you to teach you the Heimlich maneuver. We still utilize that name. We got to pay the family royalties. Okay, it's up to questioning, and then we're going to go over something else. What do you think is the answer here? It looks like I'm getting a few B's. Right? And that is correct. Did everybody sign in? Because I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I had 13 people before, but I only have, okay, everybody's here now. Beautiful. I'm going to end the poll. If you didn't sign in, make sure, that you let me know you forgot to or didn't go through, because I got to make sure you get the credit for being here. I stopped it. Okay, sorry about that. It B, the brainstem. The brainstem controls that breathing, right? It controls the vital functions of life. You must know that. Blood pressure, systolic and diastolic, heart rate, respiratory rate, pupil, swallow. Okay? But the main thing is what I just stated, okay? The pons and the medulla are the respiratory centers in the brainstem that control breathing. Okay? Number 2. Some of you read this so quick and just pick an answer so quick.
I know, I don't even have time to read it sometimes.
No, I leave it there and I don't, just read it. But some of you could read so fast. Not that I hate you, but it reminds me of my kids, my son, my daughter, my other son, these guys and ladies, they're smart. My son is electrical engineer, works for, what's that company? Fanuc. You ever saw the Terminator? That company where the machines are, he works for them. I'm like, cool. The answer is A. Observe adequate chest rise. It makes sense. That good tidal volume. Okay? Tidal volume, the volume of air that moves into and out of the lungs in a single breath. Its assessment is observed by adequate chest rise. Shallow chest is noted. The patient tidal volume is likely reduced. Remember, shallow, labored, and so forth. Okay, number 3. All of you are correct. In other healthy individuals, the primary stimulus to breathe is increase of levels of carbon dioxide in the blood. I think they call that carbonic drive, if I remember correctly. Kenneth, since you always fast with the fingers and everything, double check for me, make sure I said the correct word, carbonic drive. Okay? It should be that one if I said it right. There it goes. C. Under control of the brainstem, rising levels of carbon dioxide in the arterial blood. Test questions always like that. Normally stimulate breathing and otherwise healthy patients. So we'll say carbon dioxide in the arterial blood, increase of carbon dioxide. That's how they word it. Okay. Number 4. Number 4, a lot of you did put B. Signs of adequate breathing is the adult, including all of the following, except. Remember the except questions, the not questions. Put your finger on the except and then read the question accordingly. Signs of adequate breathing in the adult include all of the following. Pink, warm, dry skin. Oh yeah, pink, warm, and dry. That makes sense. Symmetrical chest movement? Yeah, that makes sense. Oh, that respiratory rate of 16. So the answer that should not be here is B, shallow chest rise. That's how a lot of people answer these except questions, but a lot of us fear the except and the not questions. Signs of inadequate breathing in the adult include a respiratory rate, inadequate breathing, sorry, less than 12 or greater than 20 breaths per minute, shallow chest rise, reduced tidal volume, cyanosis, and asymmetrical chest movement. Both sides of the chest do not move equally. Thank you. Just wanted to make sure. Okay. Thank you very much, Kenneth. I just wanted to make sure I was still correct. Okay, number 5. Doing insertion of a OPA, oropharyngeal airway, into an unconscious patient. She begins to vomit. The first thing you should do is to what? We said this earlier. Yeah, makes sense, right? Now, we think it's automatically suction the patient's mouth. Some of us automatically say remove the airway at once. But what we learned from the book also, whenever an unconscious patient begins to vomit, whether you are inserting an OPA or not, you should immediately turn the patient onto his or her side. This will allow drainage of the vomit from the mouth and prevent aspiration. After the patient is on her side, his or her side, remove the OPA or oral airway and suction the mouth. So you notice it was onto the side, then remove the OPA, then finish suctioning if needed. Number 6. Contraindicated, that you should not use it at all. The correct answer is what a lot of you put there, which was C. A patient who fell 20 feet and landed on his or her head. Remember I talked about head and facial injuries that they don't want you to put the NPA in there? Nasopharyngeal nasal airways are contraindicated in patients who severe head or facial injuries and should be used with caution in patients who have delicate nasal membranes or are prone to nosebleeds, aka epistaxis, nosebleeds. The nasal airway is better tolerated in patients who are semi-conscious or those with a gag reflex. Okay? You have to know the difference. I know one of them spoke about an unconscious patient with an intact gag reflex. It talks about this airway works best with an intact gag reflex. So these meanings here, or the rationale tells you why those other answers were not correct. And then it gave you the correct answer here. So it's always good. If you have access to these things, you should go on there. Did your textbook come with a pamphlet in there, like a card? Okay. Did they tell you about logging on to JB Learning and so forth? I recommend it highly. Yes. Excellent. Thank you, Kenneth. I recommend that highly. Everything you see here on the PowerPoint presentation is also on there. It also has a, what do you guys call this, ladies and gentlemen? You call it a MP3 player, MP4? What is it? Help me out here. I'm brain farting. I'm not sure. It has that there. So the book, that will actually talk this book to you while you're listening. Thank you. Audio and the entire textbook. Thank you. That's what I was trying to say. Awesome. So if you're, on a train, you could do this also. Okay, number 7. You are delivering oxygen to the patient with a nasal cannula at 4 liters. When he begins to complain of burning sensation in his nose, you should do what? Humidifier. Yes, there's a humidifier. People used to laugh at Nuki and my pointer because we actually connect the regulator there and then attach a humidifier with still water to the side, to the oxygen tank. And people looked at us like we were mentally handicapped, okay? And the patient, all our patients actually got humidified oxygen. Administering dry oxygen through a nasal cannula, especially over a prolonged period of time, can result in drying the nasal membranes, in which case the patient might complain of burning sensation in the nose. Humidified oxygen will serve to keep the nasal membranes moist. Number 8. I'm seeing a few C's. What if I tell you C and B is not the answer? It's actually what John put. It is D. Assist his breathing with a back valve mask. A patient is found unconscious after falling from the third floor window. His respirations are slow and irregular. Okay? The patient is not breathing adequately. Slow, regular respirations will not result in adequate oxygenation. You should assist the patient's breathing with the back valve mask device. Attach 100% oxygen. Suction is indicated if the patient has blood or other liquids in the airway. There's no evidence of this in this scenario. It's wording. I know it's a pain in the butt. Number 9. Yep. And 2 visible chest rises noted. Number 9 is D. That is correct. When ventilating any patient and any apneic patient with a bag valve device, you should squeeze the bag over a period of 1 second and observe for visible chest rise. Ventilating the apneic adult at the rate of 10 breaths per minute with 1 breath every 6 seconds. Ventilate infants and children at the rate of 20 to 30 breaths per minute, 1 breath every 2 to 3 seconds. Okay, for this one, I see a few of you put B, and the answer is B. You and your point of ventilating an apneic adult when you notice that his stomach is becoming distended. You should reposition his head. That means how you're ventilating and so forth could be not the correct way. Reposition the head. Gastric distension occurs when air enters the stomach. Severe gastric distension can result in vomiting and aspiration. If not recognized and treated, to minimize the amount of air that enters the stomach during ventilation, you should reposition the patient's head. Okay, we're going to touch base on certain things here. I want to make sure. Okay, got you guys there. Oh, what happened here? Hold on. Okay, we're going to go over certain things here right now. My apologies about that. Okay, are we all comfortable? And we went over this the last time. We did the whole human body, but I want to make sure note-wise it's good for you. Are we comfortable with all 4 quads? All your quads, everything that's located there and so forth. I'm talking right upper quad, left upper quad, left lower quad, right lower quad. I gave you certain ways to remember all the organs and understanding what's there. Okay, you need to know everything to do with solid and hollow organs, to do with the abdominal pelvic cavity. Okay, I just want to make sure you're okay with that. I'm talking, you got to make sure you know about the liver, the stomach, the spleen, the pancreas, okay? Things like that. Are we all comfortable with that? Yes, no, maybe so?
Just looking through my notes real
Okay,
quick.
just want to make sure. There's no rush here to go to that. Just want to make sure. Okay, someone said something.
Were you talking about when you made
I
a
feel like we can go over it a little bit more.
All right. We have a lot of time. I just want to make sure. That's
Well, I
why.
don't know about everybody else, but I know I could go over it. a little bit
Smith,
more.
that's fine. That's why you're
Okay.
here for, okay? Easiest way to remember all this is let's start with your right upper quad. Your right upper quad, I told you to make sure that these organs, you know about them. Liver, gallbladder, small and large intestine. That's LGS in your right upper quad. Make sure you know that, right? Got that so far? Liver, gallbladder, small, large intestine. That's your right upper quad. This is from your notes, Kenneth?
Yep.
Okay. So left upper quad, I always give the pancreas, spleen, okay? Stomach, small, large intestine. The 3 S's you can remember any way you want to. Kenneth put some things there for you. You can utilize that too, okay? But I gave it a little more simple. He has other things that are there, but I want you to be careful because when they ask you test questions, they're going to ask you like when you see the kidneys and so forth, they're going to say the words like the kidneys are retroperitoneal, those words. So he is correct, but I want you to make sure you know it in different terms. So far you got the right upper quad, LGS, liver, gallbladder, small, large intestine. Make sure you know that, understand that. PSSS for the left upper quad, pancreas, spleen, stomach, small, large intestine. I don't care which way you do the S's. The right lower quad, okay? The right lower quad, you have the appendix, you have the right ureter, you have the fallopian tube, the right side, the right ovary, okay? You have the small and large intestine, and you have what I always use the word ascending colon. That's the right upper quad. So don't forget those. In the left lower quad, did I say that right before the right lower quad? Yes, I did. The left lower quad, think of everything on the left side. Think of your left ureter, your left fallopian tube, your left ovary, your small and large intestine. And then I use a word also called descending colon. You need to know that on the left side. Now for your solid and hollow organs, if they ask you what's solid and hollow, remember the word okay, pals?
Yeah.
That's all your solid organs I need you to know there. And then slugs for your hollow. The okay, pals are ovaries, kidneys, pancreas, adrenal glands, liver, and spleen. That's all solid, very vascular. They bleed easily. If they get injured, they're going to bleed. Okay? Hemorrhage. That's what you need to know for that. The slugs are all your hollow that I need you to know. Slugs. Okay? Make sure you know that. Small, large intestine. Then I want you to think of the urinary stuff, like the ureters, the urinary bladder, urethra. And in the G, you could put gallbladder, and the S, stomach. Those are your hollows that you need to know in case they ask you. Okay? Note-wise, are you all comfortable when they discuss part to do with the human body and medical terminology? Mostly you saw this when they were talking about the planes and the bones and things like that. And they use words like distal, proximal, lateral, medial, mid-sagittal, sagittal, transverse, okay, superior, inferior, bilateral, unilateral. Is anyone here confused with those words? Like transverse plane. Transverse plane is like cutting the person in half, and then you have your top and bottom, your superior and your inferior. That's what they discuss. When it talks about distal and proximal, you always use the extremities. So if they talk about a superior inferior, if they don't use the transverse plane, for an example, then I want you, thank you, John, then I want you to go with the trunk. So if I ask one of you and I say, Kenneth, the heart is what to the diaphragm? Superior. There you go. And then if I say distal and I say Lewis, distal, okay, and proximal, in other words, not superior and inferior, but you can include all that in there. And I say this, using the extremities, and I say the wrist, which is your carpal, is what to your elbow. The wrist is what to your elbow.
The proximal?
Distal.
It's distal. It's away from John. It's how they put the word. So be careful. Remember the cut hat here? Okay. So distal. Okay. It's the reference points of what they use the word in. So look for words like relative or related to or relationship to. That's the words I see on exams. Make sure you know that. Okay, not bad there. Let's continue. Are you comfortable with all your muscles? And I mean the muscles that was in the human body towards the end, the skeletal muscle, the cardiac muscle, the smooth muscle, and what they consist of. Any question on that? Okay. So you know the cardiac muscle to the heart. Okay. Devin, can you give me what are the other names for the skeletal muscle?
Oh my God, I'm drawing. Well, one's voluntary. And
that's right. And the other one starts with an S.
Yeah, I know it starts with an S. I'm completely blanking on it.
Okay. Striated.
Striated
Muscles. So make sure you know that. So the smooth muscles we go over, John, that you definitely need to know always on exams. I want you to think of the blood vessels, okay? The digestive tract and to do with everything digestion, okay, which is your small intestine, large intestine, and so forth. That's also smooth. Your urinary, like your urethra, urinary bladder. Okay, so if they ask you that, you know, a test question would be like all the part of the smooth muscles except. And then you'll look and you remember all this and you say, okay, the blood vessels are part of smooth muscles, the digestive portion to do with the intestines and so forth, and the urinary, skeletal muscle. The skeletal muscle is not part of those smooth muscles. Beautiful, excellent. Okay. Are you comfortable with all your bones to do with the lobes and so forth? Okay, like if I say forehead, give me the medical term.
Is it prefrontal?
Yes, your frontal lobe.
Parietal.
And parietal here. Parietal here is to the sides. Okay, occipital to the back. Okay, they mentioned occipital. They're going to talk about to do with sight. So remember the occipital region, and then in temporal right here. Okay, temporal. So you need to know these terms and what they talk about. So make sure you know everything to do with the head, the face, and everything. So if I say all this is part of the face except, and I say, I point to it and you tell me this is still part of the face.
No,
What is this? I like that when you said no real quick.
I
What is
forgot
it?
the name of it.
But you
but
know
I
it's
know-
not part of the
I know
face.
it's not, but it's by the jawline though.
Mastoid process.
That's very processed. Yeah.
Make sure you know that. That's how they will ask you questions and make sure you understand that. Okay? Are we comfortable with all layers of the skin? Right? The epidermis, the dermis, the subcutaneous tissue, and so forth. Okay? Make sure you know that also. Are we comfortable with everything that you know that's in your urinary system or your digestive system? You need to know every part there if they ask you. So if you're thinking of urinary, remember everything and separate what a woman has and what a man has. If I use the word prostate, man or woman?
Man.
Of course, prostate. I know because I developed prostate cancer. Okay? My prostate number kept going up and up and up right after 9/11 as the years passed. And they misdiagnosed me in 2016. I wound up finding out in 2018 that I had cancer. Okay? And I'm pretty young, not that old, and that happened in my 50s. Okay? So know these terms and these words and so forth. Okay? Neurological. Are you comfortable with every part of the brain? What's it called? Are you comfortable with all the sections of the vertebrates and how many? Which one is fused? Which one is not? What keeps you alive? Okay? And if you're not sure, I'll go over that. What keeps you alive is 3, 4, and 5 in the cervical. How many sections? Breakfast, lunch, and dinner are the 5 sections you need to know. 7 cervical, 12 thoracic, 5 lumbar, 5 sacrum, 4 coccygeal. Which 2 are fused together? The sacrum and the coccygeal. 5 and 4. You need to know all these numbers. You need to know. If I ask one of you a question, C1 to C7, which one is the most palpable of those vertebrates? Palpable. C7. Excellent. Okay? So you need to know things like that. So know in order. I ask you every part of the brain. There's 3 major parts. Give me all 3. All 3 parts of the brain. Cerebrum.
Cerebrum, cerebellum, and the
Controls the vital functions of life.
medulla,
No, what part of medulla is in there with the pons called the brainstem.
It's,
Okay.
the brainstem.
So these are how you know and remember this. The brainstem controls the vital functions of life. Okay. And what it consists of: blood pressure, systolic and diastolic, respiratory rate, and heart rate. You need to know that. Those are the main 3 from the brainstem. If they ask you the cerebellum, cerebalance, that's coordination and coordination and balance. Okay, make sure you know that. If they ask you about the cerebrum, that's the big portion of the brain, the largest, right? The gray matter controls everything else. In case they ask you that. Are you comfortable with the lungs?
no,
Okay.
there's a lot. I was actually gonna ask you about the pulmonary artery, the veins, the valves, and the arterioles, because there's so many similarities in the words.
Okay. Are you talking here respiratory or are you talking about cardiac now?
Oh,
The way what you just mentioned to me right now sound cardiac. Okay?
okay. So then, yeah, I'm a little confused with those then. With the lungs and a little bit with the cardiac.
Okay. Let's go with the lungs because you're definitely, according to my notes, it's going to be to do with questions to do with your lungs. Okay. So if I talk about the lungs, you're talking about how many lobes you have. 5, right? You have 2 lungs, 3 lobes on the right, 2 lobes on the left. You have that space in between. Okay. When you inhale, you need to know the order of how the air goes down. Trachea, right and main bronchi, bronchioles, alveoli. Okay. Alveoli is where the gases take place. You need to know that process. Was that an active and passive process, which is inhalation and exhalation? The answer is yes. Okay. So look for words like respirations, exchanges of 2 gases, ventilations. Okay. You need to know that that's to do with the ambience air in the room that goes to your lungs, or the air here in the environment to your lungs. Okay. You need to know that to do that. So if I ask you the word perfusion, okay, what does it mean? Diffusion.
Diffusion or perfusion?
Excuse me. Both diffusion and perfusion. Thank you. Thank you for correcting me, Kelly. Diffusion to do with your lungs. What am I talking about?
Losing air or
Well, you're breathing in the air, but what's going on?
High concentration and low concentration.
Higher concentration to a lower concentration will be diffusion. So that takes place at the alveoli. If I say perfusion with the P, you have to think of all that good oxygenation all the way down that goes to the organs and the tissues down to the cellular level. That's good perfusion. That's to do with the cells getting all that good oxygenated blood and everything it needs. Okay. So think of you pink, warm and dry, you're getting good perfusion. Okay. Mm-hmm. That's to do with that. If it's inadequate perfusion, or they use another word called hypoperfusion, AKA shock, it's not meeting the cellular needs. It's not getting to the organs and the tissues and the cells. You see the difference? Mm-hmm. If you're not sure, this is the time to ask. Do you understand diffusion with the D and perfusion with the P?
Yes.
Okay, good. Now, you said something about the heart.
Yeah.
Okay. What is confusing you with the heart?
You remember when you told us to draw that box?
Yes.
And it was the what was it? Atria, if I'm saying it right.
Atrium.
Yeah, and the ventricle, and what is it supposed to, like, what does it do?
Okay.
Got kind of lost there.
Okay. For the heart, let's say you drew your nice Valentine's Day heart or box. Mm. Okay. Split that box in half into 4. Line this way, line that way. Your atriums are the top chambers. Okay. Mm-hmm. Your ventricles are the bottom. You need to know all 4 of those. Okay. You need to know there's 4 chambers. They have to be also 4 valves. If they ask you, what are the atrial, watch my hands, atrial ventricular valves, just think of the box. Atrial top, ventricles in the bottom. What are 2 valves between both the right side of the heart and the left side of the heart? You need to know these 2 valves. Tricuspid and bicuspid. The tricuspid is on the right side of the heart. That means when the blood deoxygenated is going from the right atrium down to the right ventricle, it has to pass through that tricuspid. Has to. Okay? Now, if you're talking about oxygenated blood, that rich blood, you're talking the left atrium going down the bicuspid, which is another name called the mitral valve, to the left ventricle. So you have 2 different sides. You know the right side is always deoxygenated and the left side is always oxygenated. So those are the boxes, those are the chambers, those are the valves. The 2 other valves you must know, okay, is the pulmonary valve and the aortic valve. Those are called semilunar valves, okay? So if they ask you questions, it's going to be to do with how many valves you have. If one open, the other one must be closed. So if I tell you this, right side of the heart, superior inferior vena cava, that deoxygenated blood is going up. It goes to the right atrium first. It goes down the tricuspid. Once that tricuspid is open, that right ventricle is filling up. That means that pulmonary valve must be closed because you got the tricuspid and then you got the pulmonary valve right here because that right ventricle is filling up. You following me?
Yeah.
Okay. Now you happen to have the opposite side, the left side, doing the same thing, but it's different. It's oxygenated blood going from the left atrium down the bicuspid into the left ventricle. Once that bicuspid, aka mitral valve, is open, the aortic valve has to be closed in order for that left ventricle to fill up. Are you picturing it? Can you see it? So then when it contracts, it does this. Ready?
Mhm.
Are you following me? One side is getting rid of deoxygenated, which is the right, and then the left side is getting rid of the good oxygenated blood to the aorta to the rest of the body.
Okay.
Okay? Okay, now I feel that you understand it a little better. So
Yeah.
don't forget, look at your heart. Not sure? Know the blood flow. Google, it's like a 2-minute animated video, the flow of blood. If you, ladies and gentlemen, are having problems with the flow of blood, Khan's Academy. KHAN' Academy. This person here, awesome. Okay, how it's broken down. And he writes it down for you and everything. So make sure you know that. Khan's Academy. You could get that on, I think, YouTube.
Okay. I'll look it
Okay. So we spoke about the lungs. We spoke about the brain. We spoke about inhalation and exhalation. We spoke a little bit about perfusion and diffusion. We know the airway. We mentioned the airway, OPA, MPA, cross finger technique, jaw thrust, head toe chin lift. Any questions on that? Any questions on oxygen?
Yeah.
Okay.
So the question that you had asked Alejandra, I believe earlier, what was it? Before we said in the ambulance, you said it had to be at the range of 2,000.
Okay.
Right.
Good. I see what you're going with that. You're talking about the oxygen tank. Okay.
Yeah.
You need to know the oxygen tank. If they ask you the oxygen tank, how much PSIs is in that tank, you know it's PSIs. Remember PSIs? I think it's what, pounds per square inch, if I'm saying it correctly. Yes? Okay. Because sometimes I confuse pounds and pressure for some reason, but it's pounds per square inch. So when you turn on that tank and the regulator is already attached, it's 2,000 PSIs. Full tank, you must know that. Any size, D, E, whatever the tank size it is. Now, they're going to ask you, if they ask you this test question, if not this exam, future exams, or the state, when you need to exchange the tank. That means when the PSI's numbers go down, when should you exchange that tank? 500. 500 or less. Got that? Now, if they ask you this specific question, any one of you, and they say, what is the minimum safe residue? Minimum safe residue is how many PSIs? Exactly 200. So you need to know that to do with the oxygen tank.
I was going to say 250.
No, go with 200. You need to know that. That's very important that you understand that, okay?
All right.
Beautiful. So let me make sure we touch base on this. We spoke about the nasal cannula, non-rebreather, BVM, CPAP, venturi mask, okay? Pocket face mask. You need to know also the OPA and the MPA. You need to know the difference in what you see in adult and in let's say an infant to do with the anatomy and physiology. So if I say, give me one thing that an infant has that you know automatically, like in comparison with the A&P of adult, I want you to think of the head first. What do you think is wrong there? What do you think is like, ooh, this may be larger or smaller or something like that? What am I talking about?
Head injury?
No, I'm talking about size. Occipital region. The occipital region is much larger. The tongue is much larger. The trachea is more narrow. This is everything to do with the infant. You need to know the difference between the infant and the adult. Any question on the OPA or the MPA? When or when not supposed to be used, or if you have a gag reflex, how you take it out and so forth, how you lubricate an MPA and things like that, you need to know. Any question on your post-ocs? The 4 things I spoke about. What's the number from 94 to 99? Things like that. What does it check for? What would give you wrong readings? All right. What number you give on the suction vacuum power you should have? There's a number. You know that suction unit is working well.
300 mm. 300.
That's right. 300 millimeters of mercury. Excellent. Are you comfortable with all different colors of your skin? You know, like jaundice, yellow, pale or pallor, white, flush, red. What's the other one? Blue, cyanotic or cyanosis. You need to know these terms. Say that again, Kelly.
I'm sorry, the first one you said, what was that one?
Jaundice, yellow?
What's that?
Jaundice, yellow is the color of your skin. When you have yellow in the conjunctiva here,
Under the eye.
your sclera, it's yellow. There's a jaundice color, they call it. Yellow is jaundice. That means there's something probably wrong, definitely with your liver. You could probably have cirrhosis of the liver, or you could have hepatitis. There's a lot of things. Known for that color, yellow, to do with the liver, is hepatitis C.
Okay.
There's like A, B, C, D, E, if I remember correctly, of hepatitis. The ones they always talk about in the state is hepatitis A, hepatitis B, because there's vaccines for that. Hepatitis C, no vaccine. I have all those vaccines in me. Okay? So you need to know in the future, if they ever ask you a test question, which one covers what. That you have to go back to your first few chapters. I forgot what chapter it was, but it talks about the well-being of the EMT and getting all your shots and everything. And it mentions A, B, C, and I think D of hepatitis. Okay? But that's later on. Are you comfortable with all the sounds? Snoring,
Yeah.
spider, rails, ronchi, crackles. Beautiful. Are you comfortable with your CPAP and your BVM and your nasal cannula and your non-rebreather?
Yeah.
Okay. This we looked over, but this you better know. CPAP is used for what type of patients?
Ones that the non-rebreather mask isn't working appropriately on.
Say that again, Kenneth.
Sleep apnea, one CPAP. Also, if the non-rebreather mask doesn't give them adequate ventilation, you could use CPAP on those type of patients as well.
Okay, but what condition did they probably have in order for you to use the CPAP?
COPD.
Conscious, semi-conscious.
COPD is one of them, okay? And another one is pulmonary edema. Okay, make sure you know that, okay? That's in case, okay? Do you know, according to protocol, what is the amount you're supposed to give? When you give that, you give the CPAP at a certain pressure. Do you know the numbers? According to protocol. Okay. That you definitely need to know for the future. Go into your protocols it should be 5 to 10 centimeters of water. Okay? They talk about that. H2O. They put it, I think it's directly from protocol, and I think you need to know that for sure. They may ask you protocol questions according to my notes, okay? So make sure you go back to that. So look over CPAP, look over what type of patients and so forth. Look at the non-rebreather, the BVM.
Where do we find the protocols?
It should be on your WhatsApp. I could have sworn I sent it to you.
You might have.
Okay, double check it. Someone look back at the WhatsApp and look
If you
at
go on,
like 90 something pages.
Yeah.
if you go on the calendar for this class itself, it links you to the government website that has the 3 links for the protocols.
Awesome, Jason, and you're right. I do not know how to upload, I think that's the word, of things I have to the Schoology. So I told Christine to do all that. You know, when I sent her this information in the sense of the Zoom link, she does all that. I have not yet learned how to do that. I'm still trying to do for another class from my computer and send them these Zoom links. And there's a bunch of the classes. I haven't sent it to them yet because I don't know how to do it. Okay? For you guys, day class and evening class, you guys are lucky because I have my own setup of my Zoom. These other companies, I'm using theirs and they don't want me no longer to download it to the cloud. You know, they say, put it on your computer. I guess it's space wise. And now I can't even send these videos out to them. So make sure, you know, you get all this. Remind me later. Just text me later on WhatsApp or my number. Text me and say, Nuki, don't forget to send us the link, please. Because you got the test, what, in 2 days?
Yeah.
Yes? Yeah, you definitely want it. So I'll do that.
Anyone else's blood pressure just rise a little bit?
Yeah, I'm sorry, but I'm telling you this right now. If you go over everything that we went over and what I just stated to do with my notes, you should do very well on your exam. Are we comfortable with all the different types of breathing? I'm talking about ataxic, agonal, Kussmaul's, Cheyne-Stokes, adequate breathing, inadequate breathing. You need to know these things. Alejandra said, please add me to the...
I got her already. She's in.
You got her? You are awesome.
Yeah, you added me. Thank you.
Thank you. Kenneth, thank you so much. I appreciate your help and all of you, Jason, and the rest of you, Devin, and everyone else who helps a lot. John, and teaching me new stuff too. I appreciate it. Let me double check my notes. And I think we're pretty decent. Hold on. So we did that. We did all the, we did that. Are we comfortable with the central nervous system, peripheral nervous system, somatic nervous system, sympathetic nervous system, parasympathetic nervous system? All those words I just stated. Are you comfortable with those terms?
What was parasympathetic?
Feed and breathe. That's when your body does the opposite of your sympathetic and it goes towards the digestive system. So let's go first with your sympathetic nervous system. That's your fight and flight. Everything increases. Blood pressure, heart rate, everything, right? You know that already. Now your parasympathetic is going to be the opposite. That means everything is going to decrease and concentrate on your digestive system. That's why we call it the feed and breathe or rest and digest. So the body knows how to compensate and take everything away and go to other parts.
Okay.
What is that, Kenneth? What are you talking about? I just read something there.
That was John asking about the WhatsApp.
Okay.
Yeah, either I could add you or pretty much anyone that I give permissions to. I'm just going to throw everyone group permissions to add
Okay, no problem. That's what it is. Because I know that was something different that you explained to me the last time. But this one we're doing is because I always do that, and it's easy for me to send you stuff. Thank you. Okay, we went over that. Are you comfortable with words like pericardium, peritoneum, visceral, and parietal, pleural, things like that?
Can you elaborate a little more on those?
Okay, if they talk about your lungs, they have what we call the pleural space area. And the pleural, they may use a word like a glistening membrane. One covers the lungs, the other one is against the cavity, the chest cavity wall. You need to know that word pleural. So think of pleural. If they break it down smaller and they want to know which one is which, then you need to know, is it the visceral or parietal, plural, because it has two parts to it. Okay, one does the lungs, okay, and one covers around the chest cavity. That's all you need to know. Make sure when you go back to lungs there, you look at those membranes that line that thoracic cavity and the lungs. Think of visceral, pleural, and parietal, plural. Okay? Good. Are you comfortable with the active and passive of breathing and the muscles that are used?
Yeah.
Okay, good. We went over everything else. Are you comfortable with the different, what do you call that? The lifespan development to do with the infant, to do with the child, to do with the middle adult, the older adult. Problems that could occur from things decreasing and so forth, atherosclerosis, arteriosclerosis.
Yeah.
Okay, good. We already went over the infant and adult. We went over the BVM, nasal cannula, CPAP, pocket face mask, non-rebreather, ventilations, respirations, all the patterns, COP, the pulse ox, we went all over that. Suction, everything. We went over that too. All right. So far, everything that I'm looking at my notes, we went over. Is there any questions that you wanted me to answer right now that's being recorded? Because we're done for the evening. We went over everything we were supposed to.
You mentioned when you were describing parts, I believe it was bones of your face and then a region that was not on your face.
Mastoid process, right behind, right here, right where your ear is, right over here. So,
And so, sorry.
yeah, mastoid process. They love to ask that question and put it there and say, all this is part of the face except mastoid process. And they'll put words like maxilla, mandible, nasal cavity, and then they'll throw in the word mastoid process to see if the M's confuse you. Because if you know the maxilla and the mandible, when you say mastoid process, oh no, that's that behind the ear. That's not part of the face.
So what is it? Is it a bone or cartilaginous?
The mastoid process, if I remember correctly, I think is part like a bone there. I forgot exactly.
Okay. But it's the point is it's to
Not
throw
part
us
of the
off.
face.
It's not. Okay. Got it. Thank
Yes.
you.
Kenneth, Nuki brain farted. Mastoid process again.
See
I know it's behind the ear, but I can't remember
what it's
exactly.
for, or
Yeah, what it is exactly.
it is a
Patient asked
it
me
is a
and I
bone.
brain-
It contains air-filled spaces called the mastoid air cells.
Okay,
Yeah.
but it's a bone, right?
Yes, yeah.
Okay, but it's not part of the face. That is correct.
Yeah.
There you go, Jason. You got it?
Yeah. Thank you.
And thank you. And like I said, sometimes I forget things or I don't remember, but I appreciate it. From you, John, and Devin, and everyone else. Any other questions? Where's that young lady? She was here. Something happened to her. She was here. Okay. I'll make sure she gets this. Okay, he's going to take care of you. Kenneth, you got what John put up there for you?
Might be tripping, but I feel like there's a couple numbers missing in that phone number, bro.
Oh, yeah, there is. No, you're not tripping. You're not tripping. I just saw it too. He did it so fast, he forgot something there.
Maybe it's 716.
Yeah, sorry about that. You guys can take my number 2 if you need it. 34.
I like that. Listen, don't mess with drugs. I know firsthand, okay? Kills brain cells, okay? Especially Jamaican gold. Marijuana, don't do it. You know, if it becomes legal, that's different. You know, there's recreational, but don't do it in my time. Any other questions? You guys are awesome. Like always, I want to thank you for having me here every Sunday. I'll see you every Sunday. If you have any questions, you can always text me, WhatsApp me, whatever. Remember, always get first from your senior instructors. The day class again is Irene and Yadiro, correct?
Yes.
Good. I know the night class is Geminis and Moon. I think it's those 2 instructors. Okay. Otherwise than that, if you have nothing else, I'm going to stop. The other part here to do with the recording. Recording is stopped. Yes.
Recording